9:01. Starting our work session at 9:01, even though there's only 5 of us here, I guess we can conduct business. Roll call, gentlemen. Philip, Thomas Walker. Green button. Roll call. Stalano? Okay. Now we'll start on invocation though, Philip Thomas Walker, can you please provide us the invocation?
For the session here, then so ado shunan akwa takne beniki to sildo shige o shche ado kwen kaiso kagido shilta hasik akoyate to lon handal shikito let's say staff and let's say council so yat enjidini do tsagi ado chinkwe yene he khayki khwati ya patso da dilzin na ganjunde eko ado ni so da shilo da hotla e do ta iga so da desin no so do e do as ado beyat eko on sa kesinde e lai etle ishin dilzen John Leko ito tashi da dilli ka la yat a tati lo yat a ko je o ato le to khati do nda de khako as a gon kenan shke da wit ego ko wan si kis ado hata ho la le che is ka do i which na jo da sa kisto da didn't na ko so there's chi top bit die to ego but edo ne jodo le ko da to ya de ni tra ado jona edo ni je jona edo ni chosan ado so ne do edo digin ne da ne ko ado ko de ya ni ke ahzen shina tsoche at dat ko ke na belash lai na khati in de ne kliniki na alchin da ne kliniki tsoke da ne ko ko ke de ni che ne e da tsoche ya che alt no ko ina tsese bijil tsese na bijil ne bijil tsa Joda de nike hatet edon nike khaz a koko nike tsi go in takisto ni jeda nati adon chweni nike do tsi so shinda ko ko tende edo in takin si kesiki de yadl bi hot shi ndawit nanel aj akonza tsati khosot elto na ajon si kisa do hani hashine lat bedilna but ado an hito shala ko ado dijin da hot do ba kunitsin do le an si kis do le indas ti do na anan hashine la bendi ka hot in ko shala ko but blash lai ka den nitle en inna Kot an hil ka dat wat an hil ko kar Kot eko, adon ne jido, tsadi kusla alto, shinzage, bigo shin ndocha, ado o chiligi bikado no selo sabina ilde, kot eko, te kwede shi natsuide, nasa konzado tsadi kus, konzado nata, den badil nilni den rodan hito, johat ade in sekiston ke in nati hot nit kot den blashlai. But eko ditje kwas anikit citizen kwat behatitzi. Be istane nadil nilto be kil istane nadil nilko. Bedadet it o behtel na andshi ilnido lil johat ade Bantas kesen leko digen den leni koko kot eko ado dejugo jota de sikis oda den hit citizen sala ni higen sala koko ni nahat ado hot ego sala ko dejugo ado dejugo to nat ado ni hitjo ado ne nejugo to ya nejugo jota de sikis to hot de in Tekis lado ni citizen sala ni higien ni ja or it's the dal so je hat shabik and long hat egot eben nashe nit la koko de je hot citizen rande dol yeln so de schnell koko de ha acho citizen bit ilna and that shada acho to na ho kwasi to ne to ja ne to citizen bit ilna ko Nakanda dolgel, nakanda dolgel koko, nakot eko, bana ikhan, lenigi jed anikisi zinigi, jabat ad dakhani zindo, yat ahit ni nadolgel, nzago ako, di dashkot abaz anigit, sabada wist, akunzago, sadahologo, sadan eko, banda has teacher. Konza dahit ni na joda dansi kis ado ko lani klinikido ni hinan shahloko ado ko la bichidan kit ol ado tna nakhate sid ko potego te ko ya hijeki na apogan biye edo ko bahas sid ol ko ni hinan kliniki choko tna pansi kis tna bayelki Nabana huit a koko, the Naban dilnish. Is it all huge ati neko? Oh, it's by Haya quake home, the blush like home, yat aho, hidden adult echo, dobachino, dobo death nego, be in that nesco, jot as anige, but it's by Haya, it's because this is banata. Quake it is la shine la Ishinde Bishnazlako, Adobana and Shigit, Adoko, Ispada, Bada, Eko, Donna and Kinbeta dead, yet, Hanbai Kadnalo, Ben Yagiko, Ebaditzi, Koko, what are they quite Yahizako, Quake, Niki Hojit lead or little coco, Niki no eat or little coco, Doko yat anan, Shadil Nilcoco, Adola Tabo. Jot bo onzakos bo tayel kitleko eko akwata bo ko hon khabiga hata nakada do hlil ni khatsa ben yen hijit nit ko ni be zil do ben yen hijit nit hot be ben ik hojit lido le johnson de sneko ko ashin benel anit nan shidil ni ko eko da ohne adiki edo da bigas leki da shin til ni ko hel kijishin eko ko de da basket ba hinne da da hanen len hinago ho na sada sa ane chota bansa kesin da shi ay holne dan le ko ado le is ho tido dil is ho inane dolt hi تشيبا تهلا تشيبا الليل تن لك كونتيت جدو بقى حسن دو أتوبيت تينتا كو أتأكو هو أتان كناو بعد هند دو كو لا كو دا يجي كده بهون تتخيت إيجو بنيه الجتنيت it out be neat either, it out that heat either, the home, hot echo. I don't know that she nashni, then lean it is yandot, it is yadahidosh as. In none it does, it and leaning, won't ask a sheep and not bend the hoodlock, actually, which is the hoodlock, hot echo. Con she that she in Hinaya get a long that, and he like is a log that cocoon. Jocon a benit tra. But it's a lot of Jota Ebanzas case of the Schneco. There's quite bad it's a isn't the quite even this case, if it has stayed or little cop, even the end of lane you could. To yon shade, should to yon it, that Anil to. Eko, o I has no Istan Iliad or the she in that it nanish. Not at it, be kidding that neatly. Could echo, could end the Ablashito, Ada Joyen, and Zil Johnson Leko, Ada Inil Neko, Ada Belanil Aniki, what out of Ishin had knit, but Ashi Hanito Shako, Edo. Banzas Kisiko, Ayan, a chong, 8 edolil, Ibenzi Kisiko, but that's a distant odil, Benashni odil home, Adashan and Adkinant Adan Lenigi, Hanazangi, large seat and Lenigi home, large home. I don't chilo, they don't chill abo, Zikos, Eko home, Dalto, Jotado Ibanza kiss, Bishmas, and that Egi home. Now the Nishidan Denis allowed a home, Zayflender than the Paul Tada. A creature home and get near Yandal Nashon, all those arts of what was those and Jota Lana needs no data, Naval Chindo, wait and then no Saturday and Lake come. The arts of what was those and Lana Masan and Yiche, Niman Yije, but that echo. Edo Ban Sikis home. I gave out about Sikis of the Danite Coco. I gave the Gobishinda Il George Lord in the Nigibika, without Ankilas Arco. Then Banil need all up, but was dulls and arts. What other in Sikis, but then the country, what Egon Sakis in 100 or little, so there's 100 or little. Giving out 8 out how a home. Sikis or little. So there's another I see it, so there's another I need linen. So there's another that is the home. He had team of car, Johnny Zend or little home. A the bear, I see. A the bench, it's zeal. Or little not teacher. But that's in home, bear has stayed or little home. Other bishop home, yet Ege, and Johnny, Johnny get a band Sikis. And the home, and I don't know, Saturday, that Ege the home. The Bansi case in Lego, that or let that get yet out on sea case of the home, but the gentles and what other bad did they go. Now, till that a Bansi case up in Yenny dark home, out end the yacht end out let it go out of a sea case of the home. Also, this is the teacher, the old Kiligi home, you one about one Bishmas and Bowen. The Navajo one, he hit also some behasted or the Jod or little so the Snake, what he has adding home, and that Kitty adding, Jod or little so the Snake home, the horn he now done the horn he zeal, and we got a John Zealand, adding horn he Jod or little so the Snake home, one that and not one day, oh, that's a little home, Banaza. Adding each of Jod or little so the Snake, but then Dane by John, the hope he getting home, near Jod or little so the Snake. Mr. Yat A. Ilchiba John, A. Dilchibe in Nani home, Mr. Beda Zeli, whom adding we getting near Jod or little so the Snake, Jod or the Jona sleep or the Jona sleep, Jona sleep, Jona sleep.
Committee members. I basically motion to have this work session, knowing the vast implications that are coming across. Some of it might be misinformation, some of it might be accurate information. So we wanted to basically be getting firsthand information so that when we go to our people, we would be a source of that good and accurate information. Even on Facebook, there's misinformation, and then of course there's also just the fact that other folks want to take it in a totally different situation to instill fear in the people. But for us, I think we as leaders of the Navajo Nation Council, as leaders of the Navajo Nation, need to be the source of the accurate information. So, Eben Ye Kwagi, motion, and I appreciate the members to have voted in favor of this work session. Committee members, I guess the other part is let the record show Honorable Chair Ricky Nez entered the work session at 9:16. And we'll go proceed with introductions. Committee members have either introduce yourself, or we can recognize guests in the audience, and then we'll go straight to the presentation order. Okay. There being no responses, we'll go straight to the work session to discuss the coronavirus respiratory disease and its impact, I guess it should say possible impact on the Navajo Nation and its people. So in that respect, we go down to item number 3, presentation by Navajo Nation Department of Health, Dr. Jill Jim, Executive Director, and then, let's see, then Mr. Herman Shorty will be presenting the first leg of the presentation. Afterwards, we'll call on Navajo Area Indian Health Service Area Director Rosalind So, Dr. Christensen, Captain Brian Johnson, and then Dr. Wayne will also do presentation. With Dr. Jim.
Yes, good morning, Chanel. The 24th Council, the coronavirus, the PowerPoint presented now the look on short Hachini Bush's Chindo, a shame to Shado, the Sonata Shanana. I am here with Mr. Herman Shorty. I'll have you introduce yourself.
Oh, yeah, they've been. I know she cut bunch and not getting never just change and she needs to change or put to national.
Okay. So we have 2 handouts, but I think I wanted to go to the next slide. We'll just have 2 clips from the World Health Organization. So we'll have you guys listen to that, and then we'll presume after that.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
There's a second video, there's a second link as well.
COVID coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Those are just some slides, and I think we can take questions as they go. But on the new coronavirus update, and there's several names that I just wanted to make sure that you might hear about, and the technical names. So on this slide, you'll see that this new virus has been named SARS-CoV-2. The disease that has been named is COVID-19. So you'll see both the SARS and this COVID-2 as a reference in the future if you see that on the news. So that's just kind of basic information, but in the meantime, we do refer to it as COVID-19. And next. And then the World Health Organization, they typically do a situation report, and I think there is a situation report 41 here. You just see kind of a picture of the March 20 date here on this slide here, that you'll see the globally impacted numbers of confirmed cases, as well as in China, how many deaths have occurred, around 2,800 deaths, 35 were new. Outside of China, there's been 104 deaths and 18 were new. And they also do a risk assessment that it's also high in China, at the regional level, very high, and global, very high. So that's just to give you an idea that anytime you want to receive an update regarding the cases, that one source that we refer to is the World Health Organization. And next. The CDC, the Centers for Disease and Control and Prevention, CDC, they also do an update, but there's occurrences since their last update of last week. So right now, if you look at the map here, you can see that there's about 7 states that are impacted, which I think will change over time, but you can see the western coast in California, Arizona, and you're probably hearing a lot about Seattle and Portland area right now with their community spread. So that's just kind of a quick snapshot of the impact that you have, and I think what I would indicate on this one that is very, very close to home. Next slide. And then this one is also the number of confirmed and presumptive positive cases in the United States. And I think since this update, there has been an additional death, but it also testing is going to be made more available and accessible to state labs. So you might see numbers a little bit higher, but right now you can see the confirmed cases related to travel were 12, person to person 3, total cases 15, total tested 472. And now, like I mentioned, there's 2 deaths at this point. Next slide. And this one's another CDC situation summary we receive from on a daily basis now. Another thing to understand is that due to the situation with not understanding and learning as a daily process, CDC regularly does updates, and we participate on those calls and receive updates. So this is directly from the CDC, basically the expanding global outbreak of the respiratory illness is COVID-19. So there's an expanding outbreak. COVID-19 is threatening to cause a pandemic. The U.S. public health response is to detect introductions and reduce potential spread and impact of the virus. It's also becoming harder to contain its spread. For the general public who are unlikely to be exposed to this virus at this time, the immediate health risk for COVID-19 is considered low, but also that this is a rapidly evolving situation. CDC is constantly reviewing and updating its guidance as needed. New cases now have no travel history and no known source of the exposure. Previously, there was a lot of mention around the guidance for the coronavirus. It was around travel history, but that's no longer the case. The U.S. expects to detect more introductions of COVID-19 through travel, as well as more person-to-person spread and community transmission of this virus. The potential public health threat is posed by COVID-19 is high, but both globally and to the United States. But individual risk is dependent on exposure. That public health partners are encouraged to review their pandemic preparedness plans at this time. Next. The community spread, this one's not from the CDC update right now at this point. Washington State and San Francisco declared state of emergency. Also, one person died but was not one of the infected, or wasn't an infected hospital healthcare worker. But out in the Washington state, the outbreak is in a long-term care facility where there were 2 cases. And I think those individuals in that facility, there were around 50 with symptoms that still needed to be tested. There is also community spread in Oregon as well, and I think there's a new county with a state of emergency, which I need to review, is the Alameda County in California. There's also travel restrictions that they share in the situation report that on February 29th, the U.S. government announced suspending entry of foreign nationals who have been in Iran within the past 14 days. So CDC has these different level 3 travel notices: avoid non-essential travel to China, Iran, Italy, and South Korea. And then level 2 travel health notices, as well as level 1 health notices. That CDC also recommends that all travelers reconsider cruise ship voyages in or within Asia at this time. Next. They also have the new information. So this last slide kind of just refers to the evolving and new information on a weekly basis from CDC. There is now guidelines for affected communities. Local authorities will implement other measures too, including non-pharmaceutical interventions. So there's a web page there. There's also the terminology or new introduction, and I think not just only individuals that may be exposed to coronavirus, but anyone with the flu, called social distancing as a way to measure its important weapon to fight the spread of this virus. Also, as I mentioned, the guidances are updated and disseminated by CDC, and then testing information and availability is changing by the day as well. Next. So due to the COVID-19, President Nez and Vice President, they convened a COVID-19 preparedness team, which included DIE, Department of Health, Indian Health Service, also I think DOTI was included, so several other Department of Community Development, Division of Natural Resources. This was initiated on last Thursday, on February 27, to monitor, plan, and prepare and coordinate precautionary efforts to address the coronavirus. Next slide. And I just wanted to just go over the authorities, so I'll give some time for Mr. Shorty for these next 4 slides.
Yes, good morning. Thank you. Department of Health, there's, with the new enabling legislation, Health Department Act CO 5014 provides the authority to the Department of Health to ensure the quality, comprehensive, culturally relevant health care and public health services are provided to the Navajo Nation. In that section 604A and C, powers and authorities of the Navajo Department of Health plan and then also the plan of operations gives as the lead agency in such events as this to ensure the high quality, comprehensive, culturally relevant health care and public health services are provided again to the Navajo Nation. So in that sense there, we were pleased that we did stand up the Navajo Nation or Department of Health EOC or Health Command Center, and in line with the Emergency Support Function number 8 which is also based as a national annex as well, Public Health and Medical Services Annex. So in that spectrum, we look at Public Health and Medical Services provides the mechanism for federal assistance to supplement local, state, tribal, territorial, insular, area resources in response to a disaster, emergency, or incidents that may lead to public health, medical, behavioral, or human services emergency, including those that have international implication. So it basically, again, provides us an opportunity to fulfill our obligation in ESF number 8. And then next slide. There, that one there is basically a chart that we abide by under the incident command system structure. So right now, basically, as support to the evolving incidences, we're looking at for the potential and the planning portions of it. So what you see there is where we're at in that. So we've activated that into 20, I think beginning of the month, the 3rd of February is when we started to initiate. But then we finally officially stood up the 27th of February. So next slide. That one there, here we have our partnership and stakeholders in our efforts of prevention and awareness. We have the Navajo Nation Executive and then you will hear executive branches, tribal health organizations, 93638s, Indian Health Service areas, which would be Navajo, Phoenix, and Albuquerque, because of the broad spectrum of coverage for Navajo. State health departments, Arizona, New Mexico, and Utah, and the county health departments therein. Also the Centers for Disease Control and Prevention, and also our respective tribes. With that there, so the first implementations that we had at the onset of our initiation, yes, was to plan and develop and issue out a risk communication plan. It being new, the new virus, I'm quite sure that misunderstanding and items based through the media, Facebook, if you will, Instagram, and those types of information were misleading to some degree, and accuracy and proper information needed to be brought together to provide a message, and also to be culturally appropriate, and then monitor the national agencies as the incident moves forward. And then also too, we enlisted a weekly communications briefing to go over the key items with key partners and to prepare and continue the response to Navajo Nation residents and constituents. And then further to, next slide, yeah, increase awareness and understanding, such as we're doing here to provide the information. We are pleased to say that on February 20th, we were able to provide a 4-hour KTNN radio forum. In the process, we learned that they manage, I guess, the number of listeners, and from my understanding, we witnessed that they were at least about 150,000 listeners that were tuned in, and the responses that were received were very favorable. A number of questions were generated and collected, and I think being responded to in various ways. So the focal point for information right now, as you see there in your handouts, would be the NDOH website there, Navajo-NSN.gov, and then also too, we do have NDOH has a email site for questions as well, and then a phone number to continue on. And then also too, the other areas is basically development and explanation on proper hand washing for both adults and children. Also too, within DOH, the programs such as CHRs, health educators, public health nurses, and other partners are conducting presentations to chapters and other interested community members. All right, so the next one, yeah. Okay, great.
So I'll go ahead and add some to that as well, and I think there's information that you have here. The blue handouts here is what we're endorsing as standard communication materials made available to the public. So we are working on making, with our partners, making the Navajo Department of Health website as far as referring individuals to get updated information. And if any of the healthcare organization or partners want to post information on there, we will like to get those information and post those for the public as well. And a lot of the radio forum information that we did was trying to address the news kind of the social media aspect and Facebook as well. And these radio forums, I think we plan to continue them as well, not just this one time. The COVID-19 name in Navajo will be shared soon. So we are working with Dodie and also previous Vice President Rexley Jim to identify a name, hopefully very soon, so we can kind of address that. Other than some names that I think we heard in the media might be the Asian disease or things like that, we want to avoid reducing those kinds of stigma for certain population groups, as well as another public education that we're working on is video on proper hand washing. So I think when that information, we're working with the Special Diabetes Program to make videos available for adults and for kids, and hopefully both in Navajo and in English, so that we can work with the schools and the senior centers. We're also planning to make train their staff to access some of those hand washing materials and making that more available as well. We have several staff here as well. We have Major Lane Bigay here, we have Feline Herrera here, and we also have other individuals that may respond to conducting presentations in the community. So last Friday we did discuss internally in our COVID-19 preparedness team if there's any chapter houses that are having meetings or agency council meetings that we can work with our public health nurses, health educators, and CXRs to be made available to make those presentations at those meetings. So I just hope that we have enough individuals going to those meetings, so just bear with us and being patient. You can also reach out to, we'll make sure that the times are booked or everything. We can work with IHS and also the tribal health organizations to maybe assist if the requests get demanding, which might likely happen. So I just wanted to make sure that we will be working closely in this COVID-19 with those partners that I just mentioned. Next slide.
Yes. Again, continuing, as we mentioned, a weekly briefing. You are welcome to join in. You have the call-in number there, and then also the access code. And there's a standard agenda that we follow through that the weekly briefings. And these are on Mondays from 8:30 to 9 o'clock in that area. And we go over the progress and plan for future events, as well as the activities that are associated with the outbreak. Next slide. So as mentioned, these handouts are the ones that are provided uniformly, commonly across the nation for presentation. No, very little deviation from these areas here to provide the continuity of information to constituents and community members. Next slide. So one of the more of the interesting things is basically hand washing is promoted to be the most effective means on the prevention measures. And I know that there's always a question about the applications of masks. CDC at this point in time really recommends no public wearing of masks. However, in a clinical setting, it is encouraged that those that are ill be wearing masks, and also to the clinicians themselves be in their PPEs or appropriate with the appropriate masks and N95s. And then again, promote again a weekly briefing in slide here. And then again, re-emphasizing email questions to the site, and then educational materials at the NDOH webpage. So next slide. Next steps. Basically, we're basically with the Navajo Nation's healthcare providers facilities. Again, the tribal organizations, Indian health service areas, private healthcare providers, as we do have a few on Navajo, and then also with the non-medical medical emergency transports, also two providers. The Navajo Nation Department of Emergency Management is also partnership. And then prevention education via media and radio will continue, as we mentioned, continue the radio forums as well as the presentations, PSAs, if you will, and then connect with the Department of Education, DODE, school districts on their efforts and their part in the outbreak. Outreach also to Navajo, as we mentioned, Navajo chapters via the community development area and division of natural resources for tourism, and then also to the division of economic development for businesses related items there. Next slide. And then here are the resources from CDC to continue on all our efforts and continuing our, if you will, ears to the ground, update each other, each of ourselves on the, as the, I guess, outbreak is continuing on in its evolution. Thank you.
And I think that concludes our presentation. I'm not sure, Shana, I don't know if you want to have Aisha's present and then maybe questions, some of their questions might be answered through their presentation. I don't know how you want to do it.
Committee members, do you have any questions for Dr. Jim and Mr. Herman Shorty? Kiel and McGee?
Chair, good morning. Ado Bishmasan, Naisi Tanagi. Ado Mr. Shorty, Ado Mr. Jim. Kodoni Joho Anigi. The one area that I like to hear or see more of is the preparation at the chapter level. The added na ACG is especially those area like the western part, Jaisi and La, tourism. What specific preparation of listing or plan of action? Because all I saw was working with the local chapters. What resource do we have for them? Chapter or taking people to the hospital, is that the only remedy right now? Nothing that could the chapter have that's available. But if these communities are way out in the rural part of the Navajo Nation, and the Nandinigi may not have a ride, or the hospital is far, what's the immediate thing that each of the community needs to be prepared for? Joe, I know Kadosh brother, one time he made a reference when where chapters, if they don't have funding, general fundings, but they have emergency fund. Akoko kodo ya hadzi denenle kuthot kahiko lego ya bishio alkoko. Atsa kojoba atlati tlelo bela do lesta tsahano kote jokha kote wenderada. We go through the approval process, but the situation is out there. And as you know, the Navajo Nation government doesn't make any correct immediate action right away. So I believe these are some areas and some reason why we always been pushing to see how the chapter can have access to some fundings for any supplies or resource that they need to resort to. And if you look at the origin of this particular disease, of course, it's overseas. He doesn't really specify what kind of animal it came from. I mean, John Hain hit Nan Lingi, go Equajet, not Loshi, what eo, Kodo, Banana, Yosin, better that I don't see no baker shita. Are we working closely with the grazing officials as well? So I'd like to hear specific, maybe from the Division of Community Development or Division of Natural Resource. Yeah, you can show us to say that we're working with them, but I got to see some immediate action to say that, okay, chapters, these are specific action. I mean, declare emergency. See, that's the thing. Wonder what that gives the green light until we get things going at the local chapter level. Speaker committee members need Lindigi, Halit all the chapters in Lindigi Yego be bought the hostility that a Oko the Basanda athlete, the door, Lee Kujib, presence officer to Nauch in the house town that you can go. But as a delegate representing 5 chapters, I always get a response to say that, okay, did all I can't really speak on behalf of the President's office, and the thing is, we don't really get specific direction or information that comes from the President's office. The first week of the month, I guarantee that this will be the hot topic throughout our planning meeting and even at the chapter meeting. So what is it that we're equipping for us as a delegate? Not Katandego chapter Lindiki, because on one of your slides you referenced Lindiki, Dado, Ado, Halal Yego, Bishi Ninita. Age Ajit and then Lingi, she Jahatahat Zito little packet. A cocoa what specific these are your talking points, and these should we should be consistent. Based on elected officials, this is the current situation. They cannot depend on store deep at the city, deep yet the city, did on Lego, Washington, Hall, Agua, did Ego, Health Organization, okay, well, that's your job. Yes, that's your job. But what specific is it that you want us to relay the message to the community that we represent? What specific is it? How is it that we want to really tell them to be prepared? Do we say that, okay, this coming chapter resolution, be prepared to draft a resolution to say that you'll have access to your emergency fund, or that direct your CHR, your grazing officials, or the IHS, or the public safety, first responder, and yet the not certainty that no the bayata so just to be on the safe side that we have already planned out for us to do this at the local level. I mean, as a government to other state or federal, why isn't that? Yes, they got all work session. Is it necessary that is it really that we had to ask for this in order to get the information? The others, so maybe when you go to based on us only clinic and hotels and the door, all the unhit Eastern innocent people who net zone or little so additional zero. That's it. That's it. Because again, I'd like to relay specific, accurate information on how the Navajo Nation is being prepared. Out of the email, which one is it that I need to forward to each of the my chapter? Because I got several documents, but that doesn't really disseminate to the general population of each of the chapters. But I hear that you guys are on the radio. I don't know if 2 hours is sufficient, but let that TV data to but more in English. So majority of our Navajo people don't understand English. How specific is it that we're really prepared to get this going and inform our Navajo people? We be able to get this particular, if we're in the Phoenix area or Salt Lake area, or even getting on an airplane. If you're traveling, this is the alert. So I like to see more specific action for our local chapter. What is it that is being directed? Not specifically to the cultural relevance. What specifically are we talking about? The cultural areas. Those are some areas you'll be surprised of what people pose questions to the council when we're at the chapter meeting. Of course, I'd like to see specific official document that will be sent to each 110 chapters, that each local chapter officials, the grazing officials, the CSC, the CHRs, and so on. These are the specific, but don't need on Jondo lessons, and I don't know if that would be developed as soon as possible to be disseminated to the chapter, because a lot of us will be attending planning meetings. I have one that's at 1 o'clock, and then there's another one at 5 o'clock I'll be attending today. So Chairman.
Sheila, Jay, Dr. Jim, Mr. Short, in regard, and then in part to respond to Jay's request, Deja Majoline Begay, would you please come up and give a brief update on how the CHRs are handling the outreach and the education.
Yad Eishmand, Mr. Chair, Major Lane Brigade Chia, Ishi Hinslet Hudijini, Bashish Chain, Hanagani, National Doska Hanzo, Dashitre, Ado CHR Outreach Program, Benat Ani, Inshla. The chapter of Yubilinda and the Shiki Khalid Aya, Bilinda, what I Nadekin, called NDOH, Joa, the PowerPoint, Hashtadia, in Hadini, DDG, Cho Indo Little Oni. So there's one PowerPoint that has been developed to be used for community health education and consistent information to navigate Abin matter. Consistent education and so CHRs, they have been getting information about World Health Organization, CDC, and we share materials. Aid chapter supervisors, they're supposed to forward those with their CHRs. Although in the health education program, health educators made and then in Kienta, we have Kienta Public Health Nurses. CHRs, when they make a home visit, chapter state for example, in Western Agency, the chapter meeting go to give updates. If the CHRs are not there to give updates, but CHR is supposed to be getting on the agenda to give updates. Although I ask for your help for the CHRs to be added on the agenda so that they can give PowerPoint information to the public. Although we meet on a regular basis and to update each other. Although I hope that was a sufficient response to your question, Mr. Begay, Delegate Begay.
Dr. Jim, there was other aspects of Honorable Kael Begay's question.
Oh, I'll go ahead and answer those questions, Chanel. Although I can't Major Lane for responding to those questions. Although the chapter house preparation, emergency funds, we are still at low risk that and then there's no cases on Navajo Nation. So in preparation, the emergency funds, we're going to have to monitor the situation as it progresses, so it will change rapidly. And when that does happen, we will have to have a plan. When you don't need in the COVID preparedness team, what kind of items would be needed as far as the emergency preparedness. We had legislative, I think Timothy came over to that COVID-19 meeting, so we're identifying those supplies or things that you're talking about that we would need to have. Although the Indian Health Service, the Tribal Health Organization, Chris Curley, they have to keep inventories. But at this point, as far as emergency funds, we're last Thursday, we barely convened and activated this group, and we barely activated the planning section of the Incident Command Center. So in the Bandahait Auto, we're starting to make those connections. We don't have the details that you're asking for at the last slide. We're going to work with the schools, the tourism, the businesses, and getting those individuals ready. So as far as the funding and preparedness, one thing we can work through with the chapters with the Division of Community Development is providing information, a handout as far as how we were talking about a standard presentation, and also begin communicating with them about their readiness. Under the Navajo Department of Health, there is a Navajo Public Health Emergency Program. In that program, we were with Mr. Shorty being the incident command, chief commander right now, with Shauna Jim James, they're working. We hope to do a tabletop exercise. We'll put a lot of what we're saying into practice, getting the nation ready to respond to an emergency or case if it happens. So there is a tabletop exercise that we've been talking about that will include all our partners and stakeholders. We have that plan so that we know we practice the motions. Chapter resource, animal origin, we do plan to work with Division of Natural Resources to see what kind of information will be available. Although KTNN and we need to elevate those radio forums on a weekly basis, I would say, making it consistent with KTNN. So it's shame that they need to make those forums available. Although the exposure report that you're mentioning, traveling, we can certainly look at the recommendations that the best way to prevent infection is to avoid being exposed to the virus that causes COVID-19, how to protect yourself. I mean, the more you travel, the more you put yourself at risk. That's the way I would put it. And if you don't protect yourself by the hand washing recommendations, with Ashe, you can look at these simple things. You can give these handouts to your planning meeting, at the planning meetings and chapter houses. At this point, I would say this is what would be the most reliable resource that you can automatically direct your chapters to make these printouts or describe the information if the CHRs and health educators are not available. I think that's all I covered, Mr. Shorty. Did I miss anything? Or, go ahead.
I want to just add that, Sanat Ani, for your information, CHRs, they're trained in National Incident Management System, that is how to respond in emergency situation. Although in the NVOH tribal programs, they're all trained in NIMS. Although in the last Thursday on that, Ms. Herrera and I, we visited KTNN on that Corona PSA. We told them to increase the messages. Although Dr. Jim Yahadzi, the flyer, an infographic, but it naniki, to distribute to the chapters. I just want to share that with you. Yeah.
Thank you. Thank you, Mr. Chair. And thank you for your question and concerns. And we are pleased to say that on the onset, we went ahead and really looked into the matter. Also, too, what evolved, you mentioned the Western Agency. Western Agency basically, yes, is the key or the most frequently visited places on the nation. For instance, the Slot Canyons and Monument Valley, places such as that. We were invited to provide a presentation to the Park and Recreation staff, also to the Slot Canyon operators in the Lacheve page areas, because of numerous amounts of clientele or tourists that were in those areas, coming to those areas there, and the majority of them were of Oriental descent or Asian descent, and the concerns came surfaced from the Parks and Recreation in that respect there. So we made a presentation which provided the accurate information from CDC and how to handle, and because it got to a point where it almost became shy of, actually there were some parts of discrimination started to evolve towards the tourists, and questions on how to address that. And so provided the information, they were able to a little bit have a better peace of mind and understanding on the management. And although there was some concern, but those areas were brought up and we were talked about. At that time, we only part of it. We had the Tuba City Regional Healthcare that also provided some input from the local area. The Coconino County Health Department also provided information in that respect as well as us, and then also CHRs and the health educators also provided, collected a lot more information as well from the concerns and developed more appropriate responses in that respect there too. Pleased to say too that your colleague, Honorable Paul Begay, was at that meeting too, who also called that meeting to come forth in that respect there.
Okay. I guess the other aspect is when KGAK was broadcasting the game at the Arizona Veterans Memorial Coliseum, before the game started, we had a health educator presenting. So that was an aspect, I think, that also helped get the word out. The other is committee members. During the spring session, we had a short, brief presentation from a young lady that was with the health education program. But I guess the thing that we realize is it's a developing situation, you know, on the exterior areas of the Navajo Nation. And basically the request for the presentation is to see how we develop some precautions, and also to, I guess, should it come, this virus come on to the nation's boundaries, then how do we react? That is we have a very vulnerable population. From my own Googling of this particular situation, it's like the elderly, ones that are have compromised health systems, to the young children, and to the pregnant moms. Those are the segments of our population that are most vulnerable, and I think that that's it's very concerning. So I have Cecilia Wilson Stewart next to make statement and ask question.
Question to Hatchman, Ado, Dr. Jim, Ado, Major Lean, Ado, and Mr. Shorty, another. Ako kaya iya, hinandish kiri iya, Ado, and the IHS representatives on Finigi Isloda. This task force, this group that is put together again, there has been some concerns on the RDC at local. Last week, the tourist and the negative and tourist season to Navajo is just this March, April, Biona. The Hugo and then the Hadeka Valley area, no, Halate out a hill with the Neto, Halate out a of our nation. You get 8 or little about that with young little, no, you had see Mr. Daniels. Around the Kodo, but in Ashadik, Hagi, Dana. Do like it's kind of Kodo TVB to national news the niki hal now about the one in Oregon nana ko bikje ko shana kedo shmaje dan da stage yeje kedan the niki da shik the niki kodo besmas on the niki ebje isla kwa deal at you go ade Kode ya to da koda shana da shli da no ya hal now. Shouldn't aigi be on a yate kato and the corner ada la sikli ota. And the kodo this coming week lo and the Clark County go that they stay no if you go home. Not that there's kind of hik and then gita corner into the kodo shana ya had zigit out corner tournament that Linigita state tournament Linigit banda they stay in the Glendale de ko kodat gita josa the ne sanita dojo the manners of those they go and sneeze right out in public. That they just used their hand and they covered their hand. Aro halik enadel nila. Dojo tan dait oro dojo khata akesota. Ihe ko dojo ba ko nil chiho. Inde kata la eta ba alejo. You know, you stated in your presentation just a living virus. Ko kwai ya he change a day. Actually, we do our best to take care of ourselves and to lay down and get the bahas and the. But that's not how you call quaggy. Nihin he kaya pakagi. Is there an area? Is there a hospital? Is there an area that is designated as a quarantine? Should this happen? Aro e hadala. Aro da kodoso news none of there's specific mask. There's specific masks where you just can't go out and buy masks. No, yada hazna. Thought eshneki holno. Aro thought nana kodo iki Vini yekwa with nashado shanado kwanana Mr. Smith again. Winter session da Mr. Smith put on legislation needs so emergency funding no. Could out by yadis kodo. The president yan he's on be to yila. Kwagi on hitis the base on the ajashi chapter managers and the job of beta hasn't done the education that egita job is with now. D could out egin hasni could out egg ebe train inole. Johnny there could have benda could out ya nada halna hand sanitizers that egita. Clorox wipes out egg. I need it with average English kid. We have public facilities, chapter houses that are being used on a daily basis. Into the Kodo, so in the Hido corner, I thought in Hanta today, quite a lot by Nate on over with Nasa. We have chairs on the side, we have rails. That is cut up by Andy Higita. Thoshin by wipe down just in Thoshin. According to the Shah, Aron the Kodo, we have laundromats, public laundromats as well. The Shah. Like I said, if it gets on the clothing Shah, those washing machines are going constantly, dryers are going constantly. The workers in there, the people that go in there. Aron da so na kid more that's le na hohe go kid say le Casa Grande and the other so news yet how to have that. See but those matching Queen Creek the you know, how involved is our veterinary service? Is there an awareness to them as well? Where are they at on this table? You know, because you know, Navajo Nation travel, like I said, for not only my fellow colleagues, but for the nation as well. It is you know, you said it's past person to person, you know, not so much on travel. I say, if you go, and they call, and then we go back to our chapters, or we come back into the legislative branch. You know, says case of it, email as a school board member for Windrock Unified School District, we were supposed to go to Washington in a couple of weeks. They thought that they need because of our safety. Put this work session on last week. Questions or concerns that yeah.
Who would like to respond? Jim?
Oh, yeah, Honorable Wilson, Dohani. With the tourism, yeah, March is the peak of tourism, not only in Page, Monute Valley. So I think we will need to work with the RDC, most importantly, closely with also the Division of Natural Resources and the veterinary services as well to get a better understanding of how we can increase education. Although in the video, when you're handling or your pets, you still have to follow those same practices of washing your hand before you do anything. Video dancing. I think the most important thing is in some of the countries, they're probably now where they're not shaking hands or they're not hugging or so I think there was even a no kissing thing in Europe too. So it's probably going to have some kind of social impact. This morning I didn't shake Mark's hand, I was giving him a fist bump. So I mean, I'm getting over it. So with that, I think you might have to just get used to that. But there's certain things, but on the prevention in the chapter houses, it's personal, taking care of yourself, and they don't have manners. That we need to encourage everyone to start taking care of and washing their hands, like for 20 seconds, like. She there are videos on it. So the evening videos that they know and it's neon just on the 20 seconds, soapy, the Nick at the look on the evening song. That's the main important thing. Although I need this hand sanitizer, but I need not the head in your purse that we get out of your bag that we go. What on the jaw, so other shit head on the head, the head of a look at the hand sanitizer, but not at the no one should get offended, I would say. There will probably be a change in how we socialize. So I need to hate on you cannot get the sneeze as so you can say something or you step away. We probably need to be more aggressive in the education part. Other than the hand sanitizers, there's none in here too. you might have to, never mind. You have to change that the hand sanitizer, for the guests that you can do that. Other offices and the employees, other chapter house, you can make hand sanitizers available, and making sure you just have it at the front desk when people when they sign in or anything. Although at these meetings that you can encourage them to clean off the surfaces. There's Lysol sprays, there's wipes that can be purchased, there's ways to be more effective by doing certain solutions with Clorox and bleach that is probably less expensive. I guess one thing that you're saying is back to Honorable Begay with your question about chapter readiness. I guess that's one of the immediate things that can be included as far as making sure there's that doors are wiped down. I'm in the office when sometimes I get our Clorox from my desk and I wipe down the handlebars. I mean, just some simple things like that you can think of, just cleaning and making that available. So I would say as this progresses, we can make mention of maybe having that more available. There's also, I know that another thing with the emergency preparedness last winter, we had our staff was exhausted, CHRs and health educators. So I think once we go through this phase of educating, we would need people to become more responsible for their own personal hygiene, so that way we don't keep exhausting, but repetitive information I think will be available. I'll have IHS maybe to the city can speak to their quarantine protocols, but I know that mask, as mentioned and before that Dr. Christensen will speak to, that masks are only effective for people that are sick, and then masks should be only reserved for the appropriate mask for healthcare professionals, because if we start just going on Amazon and buying masks, you're probably going to maybe purchase the wrong one, and even though if you provide the right one, you're going to be putting the healthcare personnel at risk when they really need it the most. So that's the regards to masks. And then I know that the emergency funding, as I mentioned, we can keep monitoring the situation and see when that we would need to begin having those conversations. Laundromats, I would say, I hope that maybe health educators and staff, we can post some of those flyers in the laundromats or in public locations, I would say, to help address the cleaning part. In the laundromat, when you go, they often clean down the surfaces. I see them do that, but I don't know if they're using the correct solution or other soap or to sanitize it, like with bleach that to use it. So making sure that everyone's using some sort of way to prevent that as well. And then, as you mentioned, with the CASA grant situation, I guess our own part is we would need to begin having conversations with the veterinary program and then Division of Natural Resources. So, okay.
Thank you. Committee members, I'm going to bring in the IHS panel because we're already running a little short. But before Mark Freeland. But go ahead and start changing the panel. You can listen with your ears while you're stepping out of the way. But all folks in the chambers, this is a developing situation. And again, we basically are calling on our health care service providers to basically give knowledge to the members of the council so that we can best provide an answer to our Navajo people when we go back to our communities and give direction. Honorable Freeland.
Good morning, all those in the gallery as well, all those listening or watching on Facebook Live, good morning, across the Navajo Nation. Shanata, I just wanted to make a few comments. I'm going to ask to be excused. I have to go pay my respects to, we lost one of our community members in Crown Point, Ms. Grace Sosi, and go pay my respects to the Sosi and Murphy and our Viso families this morning in Gallup at 11 o'clock, so I have to go join them, pay my respects. Che. Although, Shanata, I just want to make a few comments in regards to what he was saying, and you know, knowing the severity of the situation, you know, seeing the map that Dr. Jim just displayed and watching the news and the media, you know, it is continuing to spread, and knowing that there was a confirmed case in New York City, one in Rhode Island, one in Florida, one in Nebraska. So you know, it's out there already, and I think the real precaution or the information that we need to convey to our people is, you know, we need to bring it down to a grassroots level, and we need to take it down to their level and have them understand it. Don't have the focus be on Window Rock, but have the focus be out there where our people are. And I think that's going to be real important for us to convey. We can do as much as we can as delegates to provide information, and you know, relying on our CHRs is going to be important, yes, as well as the community health nursing folks from, you know, from IHS. And education is key. Education is key, whether it's in Navajo or whether it's in English. We're going to have to educate as much as we can. And I think reconveying that message is going to be vital. Reconveying that message is going to be so important. And for us to, you know, all be on the same page. Not to have different messages, but we'll have one message of consistency as well. And you know, I'm going to be meeting with my chapter soon. I'm going to emphasize, you know, working together and coming up with a, you know, we do have our local levels have emergency response teams. How can we prepare ourselves? And you know, knowing that, you know, recently, of course, I hate to bring it up, but a legislation was vetoed, and you know that our chapters could have been maybe utilizing that right now to start thinking about what supplies or what goods they could gather, toilet tissue, hand sanitizer, things like that we can probably start getting prepared for. And you know, so if and when an emergency declaration is made, you know, our chapters can be ready. And I really emphasize just bringing it down to the local level again, and reiterating that, because that's where the communication, that's where the education needs to happen. And if we can, you know, I don't want to say decentralize, but defocus the emphasis at Window Rock, take it out to our chapters. And you know, I had a pretty good discussion with one of my chapters yesterday, but educating our chapter officials is also going to be key. Eastern Agency Council will be meeting on Saturday, beginning at 9 o'clock in Tuajale. So we're going to have to bring up this topic and really talk to our chapter officials to convey the consistent message as well. There was two deaths in Washington yesterday, Washington State, and this was not in a suburb. Excuse me, it wasn't in a metro area. It was in a suburb. It was in Kirkland, and it was in a elder home. And I think we need to start thinking about our vulnerable populations, our high risk elderlies, you know, kids, our children especially. So I think we need to come up with some plan and come up with a reaction for our Navajo people, how we can best help them and prepare them for this when it does come about. So I wanted to mention that, Che, and thank you to IHS, thank you to CHR, thank you to Navajo Department of Health, as well as the response team, all those who are involved right now. And I think we need to have a strong, consistent message that's going to be across the board to everyone. Something that's not different. No janeh, none of that kind of stuff. It needs to be a strong message that education is going to be key, and we need to make sure that we continue on that. So Eria Che, I just wanted to mention that and say thank you. I need to be excused and excuse myself to attend this situation in Gallup or be with the families of Crown Point. Thank you.
Thank you, Che. Give our regards and condolences to the Arviso, Murphy, and Sosi family. Next on deck's exhibit, Rick Nez.
Thank you, Chair Shana, Honorable Soul, other honorable members have already, already seen Navajo Nation Council. I guess the rest of you could be honorable members. As I'm listening, yesterday I went to a planning meeting and CHR was there, and I was thinking about this, what everybody's talking about. In Navajo is what our elderly would want to hear, the neketche. Ha'i ebits ada dida nasnihiki. Hada ilsa bekahol jij. Not also bekayata. Aro chahoti. Hatnego. Belhaneko. Shin yat Jo isni dohagi dida a jail zoli bedi nanny lungs. But ada choshdoit ini nehnado beit ini. Dida tozes ben al kahibi yogonet at is ego ada and the dae di choshigin da nadoit ini gi hot out e beit. Do Belekiji ziko, Belekiji yosko. And the Tachit da Hanya, and then gay United Kitoles. Hait da Williadoles, a cushion hinal tlošnad nidoles. Jo ebets aro yaha, Hazlinko yaha koro, ba Hanneto ben and hidden tin. Ada has ada na gay chapter snaz nelde. The Nabia had a daily gisigishi abahani zendo lesnte. Dig hot edo hot ego. It's easy ain't kat kuda ishlatin hahot zoge koho. Hahot zoge ko ad edene bedadesh na bedet nego gogo. Yoik it eating. Tsidden leik it or tinsle. Adik echo bas na hasneko. Yo yada hans and the at the neck etcher. O ha shibelakanic etchebelchon now, o hodla. Ishin need hamasni. Corona what like it at yo de tlaniben that nerosa. Jo ebijahlan nanalia. Dushlarande kipahonaz nasa. The big height a jedel in Ebenina ye yahan nishin abachan needs and dollars. A court the Nebelchodon heat Oshin zel and the Noslenido zel and Bandas Nishigi. Dida Sad Arjigo Beos Nishigishi Bahonos and Ochuinos Idole. A coed and Nedoin Elzeda. So Sati Saint Yon Hessendal closed the house at Silla, Wolf and Dosha, so clashing or not. Ishi Bahazin go in Hidley Banda il Insa. Do Doshin Hait Ora Hadait Eda Arut Nas A the Bendis Asa. Belichara the Halnabum Begida Mossada the Halma. And the Danle is that Bekashi. Joat Atin Heloni Benina, Anhigi, Anhijon, Hinal, Locholoni, Bada Hosia, Banda of Seta, Nahabanda at Seta, Dabet negotiator, Yara Honson. I could end the day the Carorden Nabiad or Ligisigish and the garden, the Job and the note, Hinty would ego the great Hornand Nasne Sae Kuri Bedadeshna Akonda ane bat holna do hot ego khanda hol apet nene gishin na jon de notkin. Aro do shin la thonan go ai shin de kredadi ana reo kin danaj jago ya de kredon hinan shidel ene benna na kidamogo kin danal go di kredol le la besh mahas anne tlenegi aro dik as karo shin la re kojogo esto nada de hos dojo re banaje akoti aje achiko estlatin ocha hotzogi nda huizogi trapanche ort ego di konal sos ni tras ni gila betadesna de kushin bera hosen Ako shin lorat jobe khanne go yat eto joya hansen akonan tinigi shit jo the neck unless CHR that each chapters the khait ara date asto joyat ehoyan da hadon aro ICB yan haligisa akollabo hot akwashata hen heritation is koro nhetna so naidi benebigeto. Thank you for this work session this morning. I've learned a lot so far. Last night I was sitting up late just reading about more of what it entails. So yeah, thank you very much.
Sheila, thank you. I just signed and approved your travel to Washington, D.C. So you can go. Before we go back to Elmer McGee, Thomas Walker, Raymond Smith, I'd like to give time to our panel from the Indian Health Service, starting with Area Director Rosalind So.
Good morning, everyone. Again, my name is Rosalind So. I'm the Area Director for the Navajo Area Indian Health Service. My mother is from the Crown Point area. She's a Platero, and my father was from the Kaibito Lachi'i area. So we appreciate the opportunity to provide some information to you this morning. Again, as we are all talking about how important it is to share information as well as making sure that our information, number one, is consistent and is simplified to make sure that all of our community members, family members, and our patients understand what we're trying to share. Before I go too far, I'm pleased to have members of my leadership team with me. I'm going to ask them to introduce themselves at this point, starting with Dr. Christensen.
Good morning to all of you council delegates. I'm Dr. Lori Christensen. I'm the Chief Medical Officer for the Navajo area.
Good morning, honorable council delegates, Mr. Chair. My name is Sherry Helton. I'm the emergency manager for Navajo Area Indian Health Service.
Good morning, Chairman So, as well as honorable council delegates. I'm Captain Brian Johnson. I'm the acting deputy area director working beside Ms. So at the Navajo Area Indian Health Service in St. Michael's, Arizona. It's nice to be here today with you.
And with that, I will continue on here before I turn it over to Dr. Christensen to provide some information. So our goal in the Navajo Area Indian Health Service is to make sure that we have a comprehensive readiness program ready to roll out. We are already in the process. On Wednesday, the 25th, we rolled out our EOC Emergency Operations Center and activated that, and we anticipate that by the end of this week, all of our federal service units will also be in line with their planning efforts as well, which we'll talk a little bit more about. As I said, one of the things that is very important is to make sure that we have a comprehensive plan, a comprehensive, ready to go implement in anything that we can anticipate coming forward. As you have heard already, this is the information that we're dealing with is changing almost by the hour. So having to make sure that we're watching everything that's going on and having a good communication plan with our federal liaisons, our federal sites, to make sure that we're tracking everything along the way. I'm also working very closely with two of my colleagues in the Dr. Ty Reedhead in the Phoenix area IHS, as well as Dr. Leonard Thomas in the Albuquerque area. So we're strategizing, making sure that people understand what the Navajo Nation is doing in terms of leading the task force, as well as our coordinated efforts. To that, my sort of general assessment is that the Navajo area is leading throughout Navajo country or throughout Indian country in terms of what we're doing. So they are watching us very closely. I will be briefing my senior staff, my senior leadership in IHS headquarters later today to make sure that they are aware of all of the efforts made on the Navajo reservation. We do also are very fortunate that we have some experts within the Navajo area IHS. These are clinicians that have been involved and that have participated in previous efforts in terms of addressing community type efforts and these types of things. So we're relying very much closely on our clinical experts that we have. To that, though, we got to make sure, as we're all talking about here, that the message is consistent, and therefore Dr. Christensen is serving as our lead and our principal medical director over this topic. So she has to work with all of our other clinicians, and then she'll be our spokesperson on any clinical types of activities that go on. We're also working very closely and looking at what kind of travel restrictions that we might have to put in place for our staff. Again, you can imagine that once and when that first case comes on the Navajo reservation, we need to be prepared for that and making sure that our clinical staff are on board and understand what we need to do to address that particular issue. So we stand ready to work very closely with all of the healthcare systems on the Navajo that serve and are on the Navajo reservation. That includes, of course, the Indian Health Service, all of the federal entities that we have throughout the Navajo area, as well as our 638 partners, and of course our Navajo Department of Health program. So that is our effort, and that will be what we will continue to do, and how we will look at every situation that moves forward, and making sure, again, that we have a robust communication plan to help us communicate to our patients, to our staff, to our family members. Thank you very much. I'll turn it over to Dr. Christensen.
Okay, good morning again. So I'm going to go ahead and start. We're on page 2 of your handout. As was spoken before, this virus was first identified in Wuhan, China. It has spread considerably throughout the world, including the United States. This virus usually causes fever, cough, and a shortness of breath. And the spread is typically person to person, usually within 6 feet. So when Dr. Jim spoke of social distancing, it has to be at least 6 feet to keep you safer from that type of spread. This spreads through respiratory droplets, which means when we sneeze or we cough, there is some fluid droplets released. That is where the virus is passed on. This virus can exist on surfaces, and as those respiratory droplets can stay wet, if you will, for up to 20 minutes, you can still inhale it from surfaces that are nearby. Once those droplets dry, you can still get the virus if you lean on it with your hands and then touch your eyes, your mouth, or your nose. And that's why we really encourage frequent surface wiping in your homes or in any areas in which you work. The symptoms for this virus typically occur between 2 and 14 days, with an average of approximately 5 days. However, longer periods have been identified up to 27 days at other places in the world. This virus can remain a fairly simple, straightforward virus with just home care, but severe cases can result in pneumonia. Since there's a lot of questions about pneumonia, I wanted to explain that pneumonia develops after or alongside a respiratory illness. The germ gets in your body and it causes an infection in your lungs. Pneumonia is also contagious and can spread again from person to person. This can be viral, as in the COVID and flu, can be bacterial or fungal, and it can result to either a mild cough or a very severe cough. Most vulnerable are the elderly or the very young. I do want to say, though, with the history of COVID-19 so far, very few children have gotten this virus, which is good news. But it has been very hard on the elderly or those with complex medical problems. Dr. Jim shared some information. There are 2 new cases as of this morning, and we're now in 10 states, including Massachusetts, New York State, and Rhode Island. We anticipate this will continue to change multiple times a day. The CDC does put out status reports on Monday, Wednesday, and Friday, in which we will keep and track very closely. The states with, as we said before, has spread to 10 states now, a lot of it on the Pacific coast, but it seems like the East Coast is now becoming active, unfortunately. So, I want to go over a big list of what to do if you're sick, just to give you some idea of the process. We'd rather you stay home unless you need medical care. No work, no school, no being in public areas, and that includes public transportation or any public venue such as a basketball game, a flea market, and such like that. Stay in a specific room and do not be near the other members of your household. You want to restrict contact with your pets and animals. This virus can be transmitted both to animals and from animals, of course, to humans. If you do need to go to the doctor, by all means, we want you to get care. But we'd like you to call ahead if possible so that facility, healthcare clinic, or hospital can prepare for your arrival. Cover your coughs and sneezes, not with your hands, with your elbow or a handkerchief or something over your face, and then throw that tissue away and wash your handkerchiefs frequently. You don't want to keep using the same one and reinfecting yourself. You would only need to use a mask at home or when you're around other people. If you're just in your room or living room yourself, you do not need it. We don't recommend masks out in public. There's no need for that. The mask should be applied if you come down with the symptoms. And when you're seen in a healthcare facility, we will change over the mask to the N95, which is a more intense mask for you to wear. So we will evaluate and then change your mask as needed. Wash your hands often, just every chance you get. And it's at least 20 seconds. You can sing happy birthday to yourself, whatever song you want, but you want to make sure you get in your 20 seconds. You can also use a 60% alcohol-based hand sanitizer, and what you want to do is rub until your hands are completely dry. You have to rub it all the way in. Don't share any personal household items. High-touch surfaces, clean them. Just keep cleaning them frequently. I do want to say, if you do feel like you need to use Clorox, ventilate your room. You also don't want to use full-strength Clorox in a closed space because that can cause some reaction in your lungs. So be careful with the Clorox. Monitor your symptoms, meaning we'd like you to check your temperatures every 4 hours at a minimum and keep it written down. So if you call a healthcare facility or you have to go in, you can tell them what's been going on with your temperature and fevers. If you are placed on self-monitoring, that means, as we said before, you're going to stay home for those probably 14 days, and the state departments will be in contact with you. They will check in with you. The process is when we take someone into our healthcare facility, We put them in an isolation room. All of our facilities has been told to identify a room for new possible patients. We will then put a mask on, finish examining, give you the care that you need, and decide whether you need hospitalization or you can be discharged home for home self-quarantine. We then tell the local health department and/or state department that we have a possible person with COVID, which is called a PUI, a person under investigation. They will then monitor and they will ask you for your contacts, ask you where you've been, and they are responsible for the investigation of mapping that out in regard to your particular possible exposure. They will then check on you at home and make sure that you're doing all right, and if not, advise you to go seek further medical care. Once you've completed that time period of 14 days, then that will be coordinated with your primary care doctor and the Department of Health of that state when you should go back out in the public and how you should proceed. So those are kind of the first steps that you will be following. As far as testing, the states will begin very soon. In fact, we got an email from Arizona Department of Health right before we came here. They do have the kits, and so all of the Arizona facilities will be able to get testing within the state of Arizona, so that we'll send that information forward. CDC has manufactured new test kits, which are very, very specific to the COVID virus, which they did not have previously. Those results will go to the doctor, patient, of course, and appropriate local health officials, which in many cases is the Navajo Nation Department of Health. All labs in our IHS area have been getting guidance on proper collection of the specimens, and they are today preparing packets of the tubes and the collection kits so that they are ready to use them immediately as needed. So persons reported as under investigation, both local and state departments will continue to follow. Treatment, unfortunately, there is no specific treatment for COVID-19. It is supportive care for your cough, for your headache, for your symptoms. There is no vaccine, as was pointed out before, at this time, although I know multiple sources are working on a possible vaccine. If you are having trouble breathing and coughing, you very well may need in-hospital support for your pneumonia, and you should proceed and receive that care. I want to emphasize, while we are heavily preparing for COVID-19, there are other illnesses we still must be very careful about. We're having a very high flu season in Navajo area, and CDC has estimated so far 32 million illnesses, 310,000 hospitalizations, and over 18,000 deaths from the flu. So while we're being careful in this preparedness, we also have to remember the things that are important to prevent and take care of spreading the flu. This is a New Mexico flu summary that you see on page, I believe, 10, where there's been 72 deaths and a total, just in this time period so far this year, of 110 deaths. So very, very serious. I added Arizona in. We're ahead of last year's cumulative totals for the state of Arizona as well. And there's a graph from Utah, which also shows that red line that goes above is our numbers for Utah for this year. So we are having a fairly heavy flu season. This is a graph of the Navajo area. In the blue is the national statistics, and in the black, you see Navajo spiked about 34 weeks ago, maybe 6 weeks ago, and it's continuing to be higher than the national. However, hopefully it's coming down and will continue to do so. Where much of the nation sits in the probably 4 to 6%, we're more in the 10, 11% of all those seen are presenting with influenza-like illness. This is also another comparison from last year to this year. As you can see in the blue, we spiked again very early. We stayed up. We are coming down. Last year at this time, we were having another spike, but hopefully our trend will continue downward, which you see on this particular graph. So what do? Please get your flu shots. We heard numerous honorable delegates say they had not gotten their flu shots, we heavily encourage you to do so. Follow the same precautions as COVID. It's the same type of transmission. Wash your hands. Cover your cough and sneeze. Don't go to work, school, and public areas if you're ill, because that will also spread. And our patients and the people of Navajo are very vulnerable to these respiratory diseases, which also includes the flu, and in the children, RSV, which is also fairly heavy this year as well. Okay, so now at this time, I'll turn it over to Ms. Helton.
Good morning again. So as Ms. So mentioned, our Emergency Operations Center activated on February 25th, and the focus of our EOC activation is to start the planning process and also ensure that our hospitals are preparing and getting ready in the event that we see cases of COVID-19 at our healthcare facilities. So we are having daily briefings, Monday to Friday. We're not activated during the weekend, but during the weekday, our initial briefing is at 08:30, and then we have a closeout briefing at 1600. So our focus in regards to our Emergency Operations Center, as I mentioned, number one is our healthcare facility readiness. We're also assessing availability of resources at our Gallup Regional Supply Service Center, the availability of masks, N95 masks in particular. We're also looking at medical supplies as well as cleaning products. In addition to the resource assessment, we're looking at healthcare facilities on the availability of medical supplies, the N95 masks, and the cleaning products at each healthcare facility. Number three, provide support and guidance to our healthcare facilities. We have subject matter experts at Navajo area, and so we want to be able to provide information to our healthcare facilities and provide that technical assistance as necessary. And then number four is the communications. We developed an organization structure, and it outlines the communication processes with our healthcare facilities. With the activation of the Navajo Nation Department of Health Emergency Operations Center, we established communications with the designated incident commander, Mr. Shorty here. At our EOC, myself, as well as Captain Gordon Satok are functioning as the Emergency Operations Center managers. So our EOC objectives right now, we're maintaining situational awareness, obtaining information from CDC as well as the states and counties, as well as our IHS headquarters. And we're in the process of sharing information to our healthcare facilities. We want to be able to track and monitor our warehouse assets in addition to the hospital resources. We also want to develop guidance for the deployed commissioned officers that are responding to COVID-19, ensure hospital readiness, and develop a patient overflow plan. In the event that we have multiple cases presenting at our facilities, we want to develop a contingency plan. And then number seven, coordinate with our external partners. So our emergency operations phone numbers are listed above the EOC managers. We have the resource support section, the planning support section, and the situational awareness section currently activated. So if any of the Navajo Nation programs would like to get in contact with us, these are our phone numbers at the Emergency Operations Center. Thank you. So how we're organizing, it was mentioned earlier about National Incident Management System. We are using Incident Command to manage our organization, streamlining communications as well as information. So with that in mind, various agencies are activating various portions of their system, which allows for flexibility as well as the integration of the various structures activated. Existing structures with Navajo Nation and IHS focus on the planning efforts. Again, we're emphasizing the planning efforts. So here is, next slide, please. So here's our organization for our Emergency Operations Center. As you can see, situational awareness, these individuals are obtaining information on guidance materials, which are being shared with the healthcare facilities. Under planning support, the hospital planning, we have individuals designated to contact our healthcare facilities. Right now, we have a set number of action items with our healthcare facilities on what we want to see, the status of their plans, the screening process, number of isolation rooms, the availability of resources. We had a set deadline to receive this information by Friday. As of our debriefing, we still needed information from some of our healthcare facilities. In addition, we are obtaining information on our designated patient overflow locations. Same thing, a number of isolation rooms, the availability of resources. Under our resource support, we want to ensure that the Gallup Regional Supply Service Center is providing us inventory of the critical resources that we identified. Also under the resource support, we want to be able to track those commissioned officers that are being deployed. We know of the 45-day quarantine, and so we're developing guidance. We have a final draft for guidance to the commissioned officers who return back from being deployed. And as far as Friday, we just activated our public information officer who's going to coordinate with the Navajo Nation PIO as well.
Young lady, may I just interrupt you just a second? On this particular slide, that's on page 11, the top square, EOC manager, there's a young lady that's named Zoe McKenzie, committee members. She's a veterinarian. So some of the questions that you posed in follow-up, then she would be a person that would more than likely have subject matter expertise regarding, I guess the main thing, Japane, it's Ado, they sneak it, Johatnia, Ado Harusi, Belashlai, Bigija Hazli, Ado Katnahni, Oko Katats, Yato, Belashlai, Only Nalkloshi, Ajat. Not undot ni lot echulla. Jo kwagi she lato benaidil kidoli. Jo kwagi lato michatil away behatsi yatsunandai. Just we. So that would be something that in follow-up. What I see, what I foresee is this is periodic presentation. New information is coming forward. As our panel said, almost on a daily basis. So this is something that is not a one-time presentation. We must understand that. So, and part of our work is to stay abreast of this new information. Vance's case, as I preside over this meeting, Otto, you may go ahead and finish your presentation, and then we'll go to Honorable Walker after that.
So with this organization structure that's on the screen there, pay particular attention to the hospital planning. The next slide, please. This is the actual breakdown of that hospital planning group. Here you see our 5 service units. Under the 5 service units, you'll see the health centers as well as the clinics. This is the communications flow that has been outlined to our Emergency Operations Center. The next slide. With some of our assessments that are being conducted right now, we've been reaching out to our 638 facilities, and right now we are receiving information from the 638 facilities with Winslow Indian Healthcare Center, Teuto Medical Center, and Tuba City. We have staff that are going to be reaching out to NACA, Utah Navajo Health System, and San Juan Southern Paiute. So we'll have a status of information, and we'll be sharing that with Dr. Jim and Mr. Shorty. Now, if in the event that we do receive cases on Navajo Nation, our organization structure is going to transition into what is called an area command organization structure. Why we want to transition? Because we have the Gallup Regional Supply Service Center. We want to be able to monitor those critical assets that are going from the Gallup Regional Supply Service Center to our healthcare facilities. So if a healthcare facility requested for 30,000 masks and we only have 50,000, through this organization structure, we're going to be able to make decisions to ensure that we have enough resources covering each of our facilities. And then what would this organization structure look like under Navajo Nation? Here's an example. The Navajo Nation Emergency Operations Center would most likely be activated. Our area command would be under the Navajo Nation EOC. Examples of activated divisions, you'd see Community Development Division or Department of Health. I'm sure Navajo Nation will have other boxes or other divisions activated. So in addition, you can see how the county, the state EOCs are integrated into the structure, as well as the FEMA regions. In addition to the left of the Navajo Nation EOC box, we have a box called the Navajo Nation Policy Group, which would be made up of the Navajo Area Office Executive Leadership, Division of Department of Health, and the Division of Public Safety. So in summary, as of today, our hospitals are activating their planning portion of their incident command. Hospital and warehouse readiness continues. So we completed the commission officer guidance. We have a final draft, which includes the mandate of the 45-day quarantine, communications and coordination throughout Navajo area, IHS, as well as the 638 facilities continue. The Navajo Area Office Emergency Operations Center continues to support the hospitals, and this will also be the case if we have to activate our area command. Our EOC will maintain contact with the Navajo Nation Department of Health, incident commanders, and the Navajo Nation Department of Emergency Management.
Thank you. Again, as I wanted to share, or as I shared from the beginning, that is very important that we have a coordinated effort throughout the Navajo Area Indian Health Service and with all of our partners. I will say, and one of the things that I'm committed to is making sure that we provide the the best and most current information to you, as well as some of the challenges that we're dealing with within the Navajo Area Indian Health Services. I said I believe that this is the Navajo Nation plan is probably one of the most robust plans that I've seen throughout Indian country. In addition to that, we have expressed some concerns with regards to, we have approximately 300 commission officers that are coming and going at any point. And this year, the Department of Health and Human Services, within the Department of Health and Human Services, changed the way that they seek approval for commission officers. So what they're telling us now is that they don't require supervisory approval anymore. And this model, this type of sort of jumping over, just what are our needs and how do we best plan, I believe continue and will continue to be a problem for the Navajo area, probably all of IHS, but still having 300 officers being deployed at any given time while we're still trying to maintain our work, which is to take care of our patients throughout Navajo area, is a problem. And so with that, on top of that, we're asking for clarification from the President's office for the 45-day additional quarantine. Right now, nationally, we're required to do 14 days. That's what you have heard. That might change. But moving to the 45 days, we're trying to figure out how do we specifically address that for our officers, meaning that, let's say, for example, we had an officer deployed from Chinle. If we comply with the 45 days, where do we put that officer after the 14 days? Can we move that officer to Gallup or someplace off the reservation? So we're looking at those kinds of things again to make sure that we are absolutely clear and that we comply with the recommendations and guidance coming out of the Navajo Nation. So I want to turn it over to Captain Johnson really quickly just to talk about our efforts to address the requests coming in for commission officers and making sure that we, again, continue to meet the needs of our patients while we're also working with the Department of Health and Human Services on deployment of our commission officers.
I was going to say good afternoon again, but still good morning. So in regards to Commission Corps officers, and you'll see the uniform that I'm wearing today, which is a USPHS Commission Corps, what we refer to as the ODU uniform. And in times of response or deployment, we are required to wear this uniform. So for the interim time, we've been requested to send a national signal that we are ready to respond to the coronavirus as a group, nationally, within the Indian Health Service and other agencies within the Department of Health and Human Services. In regards to our communications, whenever an officer is deployed, basically how this works is we get a notification from our back east and out of headquarters that comes in. And we basically receive that at area office, and we look to our service units. We also work in conjunction with the 638 programs. And anytime that we have a request, we reach out to the CEO, whether it's a federal or a 638 operation. And we ask if this officer can be deployed and not negatively impact patient care. In some cases that is possible. However, in other cases it's not. It depends. If we're talking about pharmacists, if we're talking about nurses, sometimes we have staffing deficits where we need to make sure that we are providing the care here at home, and then we communicate that back. But as Ms. So has indicated, there is a change going on at this point nationally where the USPHS has the ability, if need be, as a national emergency, to reach out and to deploy officers. And so we are currently working as part of the EOC at area office to make sure that we're tracking any requests that comes down or any mandated deployment at this point in time. And then we'll be tracking that, as was indicated at the EOC at area office. We meet at 8:30 in the mornings and 4 o'clock in the afternoon, Monday through Friday, to discuss. This will be one of those items that we'll be tracking throughout. We're also reaching out to our headquarters and letting them know of our situation, of our status, and our need for staffing here locally. So from Navajo area, when we talk about priority patient care, here is our priority, making sure that we have adequate coverage, and we'll continue to do that. We'll also continue to notify and to communicate with headquarters through Ms. So as well, in terms of where we stand and how we're doing in terms of staffing. So that's essentially how we're handling this in terms of Commissioned Corps officers that may be requested to deploy.
Thank you, Captain Johnson. And one final thing that I want to elaborate on a little bit, again, is we're at this slight vulnerability with respect to our officers. So when our officers are being deployed, they are being sent to places sometimes we don't know where they're being sent to. So we need to make sure that we're tracking where our officers are going and where they're coming back from. So implementing the 45 days is good, as long as we know where we need to put that officer for additional 30 days above the 14 required days that they will be deployed from. But having said that, the vulnerability is that we did have an officer that was deployed. We didn't know when they were coming back and so forth, and then they had some symptoms of being sick. So we had to take, and we were taking additional precautions with respect to making sure that we were testing appropriately through the state of New Mexico to track that officer. So I'm asking, again, for some support from the Navajo Nation, this council, this body, to help us clarify how we treat our officers from here on out. In that, again, I'm still trying to meet the needs of our current patient, current patient needs. And then when they leave and we don't really know where they're at, I believe that the nations, the tribal nations, need to be clear with the Department of Health and Human Services on how we track our officers and where they're going and when they're coming back. And we should be part of that messaging, and certainly part of the ability to approve or disapprove more easily than it seems to be right now. So I will conclude with that from our presentation. I would thank you. We can take some questions.
Okay, committee members. Next on the list is Sager, Honorable Elmer Brigade.
Yate Sherwe, Aro Kahoni Klanido, people that are here with us. So Yate, good morning. Aro the panels that are here with us again. Aro Jido, Dr. Jim, doing your presentation to, I guess, to start a conversation, to start thinking about the virus that we're talking about. That it came down to some group of people last night that was over there called, I guess you could say that one of your loved ones are being told to deploy as being the commissioned officers. That's when the parents, the grandparents starts coming around. They start thinking about what's our kids, they'll be going to that place for us. How do we prepare? How do we ensure that our kids is going to be coming back? That they'll be going to this a virus that's who created that? Why are our kids going over there? This is our loved ones. There's the question that they had. So they started off like that, the conversation. So where did it lead to? It became a gathering of people there where I was invited. They had a ceremony there. And what kind of ceremony it has to be? What kind of ceremony it's going to be? Who knows? As they're coming down to a medicine man, you identify this is what's wrong with it. You've got one step, and now you would know that, but they had to eat out. What is it? That was the question. And what kind of prayers and songs are we can use to defend ourselves? to make sure what is it. Then the first question they will ask is, does it have eyes? But it has a body, this disease. That was the question that they have. Very interesting. A non-Hastuido Sani, Hastuidan Lon, these are elderly people that never went to school. They have a question. And we all tend to this person. Wow. Thinking about it, how these knowledgeable people, we have all these educated people that we have, but we tend to this person that doesn't have any degree. And now we have to come to you, ask that question, what is it? How did it live? How does it make this itself to where it could kill people? How did it live? How did it form? That was the question that he had. He went back to the back at the beginning of the world, saying that this is the only way a living thing can live, is it has the 4 elements. It has to be in it to create a life, and it can destroy something. So I went back to that place. Very interesting to me to look at that person. Really rare too. Only a few people, those kind of elderly, still living with us. Wow, nobody don't really care about it until something happens. Then they say that this is our home, the 4 Sacred Mountain. There's a shelter, and there's a light there. We can prepare here. We can get saved here. Think about, put your mind back in here. No, just thinking about it, what kind of faith do they have? Wow, just thinking about it, how much faith do we have? Thinking about it. Don't think about something will happen to you as long as you have heard songs and the faith. The beginning of the world, this is how it was, talking about it. To be indigenous people, to be a Navajo, to be a Diné people. We have that. Let's use it. Let's take it back out. Let's defend ourselves with it. That was the message that he got. So, within that, something like it can be, how did it came? What happened? What's going on with this world? There's all these plants, animals that were being destroyed by fire. It came to be form of it went into atmosphere with this air. It went into the water, it went into the ground, it went into our air that we breathed in it, the oxygen. Is it coming from there? What happened? Who did that? Why did they do that? That was the question that they have. What are we trying to look for? What are we trying to do with this earth? What are we trying to do with this world? What are we doing as a human being? Who did this? How come our minds like that now today? It was a question that he was going through this. So, even now, to think about it, it was so interesting, Very fortunate, thinking of myself, that I still know some of these people. I still greet them, I still go over there to their home. I still bring in some food, just to see them, just to talk to them. So, today, so I want to share that with you. I had a ceremony last night in the midst of Tisto chapter So very interesting. It's just only elderly that were there. There's no young people there. I probably was the youngest person in there. Thinking about it, these are people that have, I guess, if you're an elderly, if you have elderly at home, you would have this, you want to know that you start worrying about it, how can we survive? They're very old. We don't want this happening. So that's the reason why we're here. Down no na hasta. They're very, I guess, concerned. I would add if we have an elderly, this would today. I would that add. So, is this a priority for the Navajo Nation? If it's a priority, what do we do with the Navajo Nation government? What can the Navajo Nation government? That was the question they posed to me. What's the Navajo Nation Council doing? What's the Navajo Nation government doing? How are they going to address this? How do we ensure that we can be protected? They're working out there is to work with this money. But they have money to work, but us, we're unemployed here. So what is the plan do you guys have for us? Is there anything that's going to be like, we got this, they put this money together to do that. That's what they did. So I was driving in this morning again, I got a call, so I had to, that to lose a signal, that is a part there on the road, talking about this, about Tehotso hospital. They're going into this, who do we use? Who do you depend on these, the people that can help us? Let's use our gifted, or people that still have the ceremonies. Who do you able to use down Noada? Thinking about it, I guess we came to a stage to really start having plans for this. What's our priority? What are we doing as a government? And then as a entity with the Navajo Nation, today. So the priority that we can be making, we have all these talking about revenue, talking about how we losing our revenue. Everybody's worried about it. But these things that are coming in, how we're going to do this? Or we're going to still think about the priority of generating another revenue? That was their question. Are we beginning to be like who created this? Somebody looking for something and then they started burning something, trying to look for something, trying to survive on that side. How about us? We're trying to survive here with what we have here. There's all these, today. My question is to hear is, how is, by looking at your structure here, planning structure, it's a planning, it's just still a planning. It's not up to where, it's structured to where this is a concept that we can go by. The relationship that we're going to have, what IXS, the relationship that we're going to have with the Department of Health, Navajo Nation. How are they going to be, when are they going to do this Kodosha Deja, their plans compared to IXS plan? When are they going to be put together, or how much IXS are you going to acknowledge or Navajo Department of Health plan? How we're still just now planning. It just says planning. This is how it's. If something happens like this, it's already going to be like something, a virus that's outbreak. This is already going to be. It's already structured. It can go into a person's body. So there's going to be another stage where that's what they're preparing it like that. But it comes down to where Ishahina has two ayego, Hinane dotish, Ashbiga, what Ashen, or shall we do it individually at home? This is just too much. What Ednahan, just don't know that they necessarily. So it comes back down to where Mahaloda has Haloda. Hoche Homosan the Haloda, and Nosella Halon, to add a Yaquaki, a bad cat into this. Just don't know that Yadas today. So, in that article, the structure, Kate days in the land, with this, don't capture now, just like how you guys are here, beginning, just like you have the offices, you have something to work with. A paid or that Ada. So, I'm here to see how much of the Navajo Nation Department of Health, their plans, their priorities, if something happens like this, how can we start working together? That structure is going to be like this. That not be.
We'll go to Thomas Walker.
Chair Pro Tem, although committee members that are here today, although presenters though, IHS Ms. So, for coming before the Navigiyati committee's work session, although your team there, Sherry Helton, Yate, thank you for your report. Although Captain Johnson, though, and the doctor also, so that creates the panel that gave the presentation from the IHS perspective and so forth. As I sit here listening to the report from Indio Action and IHS, and then we have it listening to my colleagues here, still just puts me thinking about focusing on Navajo Nation, Navajo area, Navajo Nation, though the different regions or agencies of our nation here, and then all the way down to the chapters. Thinking about that, not only the concept of electing leaders, whether they be school board members, health board members, grazing officers, chapter officials, or council members, and of course there are other types of positions that need appointment or elections by constituents. So I believe that they're all the same in looking out for the interests of Navajo people. Whether you're elected, appointed to a school, oversee a school or a hospital or chapter, you're there basically for the people, as we always want to emphasize in our communications to the public or constituents, the nepasits. We always say that, and it is true. So that being the case, I think in the event there's a public health emergency, we must also be employed to help or deployed to assist our people in the way we can with the resources that we have, the information that we can use. And Ms. So, you mentioned information, messages being simple and consistent, being sent out from through the media. I think if you were to devise a very simple, very consistent message, and if you were to give that to us as public officials, public leaders, I think that's one way to get the word out. I know that officials have daily contact with the constituents. Ada, I can see there are more than several hundred elected officials, you know, just interacting with people every day, every hour. So I think we have a resource there that's available. We need to make ourselves available. We need to step in, step up, and be ready to assist our health authorities and our government in this event. Let's listen to the report with the with getting the information so we could also use it. And let us not be part of any kind of misinformation or confusion. Let's be simple and consistent, just like the healthcare authorities, and healthcare providers. I appreciate the discussion, the information, very important, and this is unprecedented. What the history, unfortunately, it's history in the making of where we're all cautious. We're all, you know, very concerned with that as we look at the media, our country, and the world. Then refocusing back here on Navajo, you know, we have to protect our children and our elders, always with that. And I think as responsible leaders, responsible adults, we have a role to play, certainly. And I hope as Navajo people, we believe that the elements like wind, rain, fire, we believe they are powerful elements. They're life-giving, life-sustaining. They too, in the natural ecology, they too have a way to suppress these kinds of dangerous elements, in this case viruses. I hope as the days warm, as the daylight extends, as the great winds come, you know, I hope it addresses some of these illnesses, airborne, you know, illnesses and viruses. Ada, as my brother, Mr. Begay from Delcon alluded to, we have to believe that also that the earth and Mother Nature has a way to take care of us, has a way to sustain our living, Ada. But we have a role to play also. This is a reminder we need to really look at ourselves and the way we take care of our home, and even if we're in someone's home, even if we're in some place like this is a public place, we all have a responsibility to make sure that the sicknesses, the illnesses aren't caused, you know, by just us being careless or irresponsible or forgetful. I think this is a time when you think about yourself, everything, every contact with even animals and people, and the things we, I guess, come into contact with. We're mindful. I think it's going to get us back to that point, to where we're recognizing that, you know, cleanliness and sanitation is very, very important to us and everyone around us. And we all have that responsibility, and it's doable. And I'm interested in hearing from local healthcare providers also. So the IHS Navajo area, either administrative, and you give us the necessary support resources for our healthcare out there at the local level. Although NDOH being the government and being that authority that it is, these are necessary to have in place. So the local healthcare providers, glad to see Tuba City Regional Healthcare Corporation here with us this morning. They are the frontline people. They first would be the ones that would receive, the sick and need provide that care. So they're being the first responder. I'd like to hear from them as far as their readiness and how they're preparing and that kind of thing. Chair, this is the beginning, and at some point, the committee members, the standing committees also are very, very busy, and we usually go out into the communities for outreach and make contact with different entities and resources out there and the general public. Public health messages and public health concerns, not to overdo it, but again to remain simple and to the point and be consistent. Getting the information from IHS or NDOH, we use that as our tool to be of assistance. Thank you.
Okay, thank you, Cecilia. I guess just the way I handled the previous panel, if we could transition into, and I guess remain on the floor, take one of the positions on the delegates sit, in case there is specific questions to you. Then we'll call on Tuba City Regional board members and providers. Then I go to little big brother, Raymond Smith Jr.
Thank you, Shania, and those that are here with us regarding the concern of coronavirus disease. And thank you for setting up this work session. It's very educational, and it's something that we shouldn't take lightly. Just by hearing and by sitting here observing, there's some questions that came up. There's the word such as epidemic. When I looked that up, that's like a local community infection or virus, or communities are affected. And then I looked up pandemic. That's very serious when that happens. And then there's that global pandemic. My question is, where are we at with this? I know China's at an epidemic, if we look at it, if it was there, and if they wouldn't travel. But now it's becoming pandemic, and it's starting to go into the global pandemic. So what is the CDC and the U.S. government? How are they going to address this? I know I've seen in the flyer here saying that they're trying to do some restrictions from folks traveling to China and those areas that are folks coming back. They're keeping a close eye on them. But we all well know that the ease of travel has meant that the virus moves faster. It's kind of like that movie back in the day when that monkey had caught a virus, and that monkey and the folks started traveling from country to country. And I think that movie was called Outbreak. if you guys recall that. And it's coming to the same way. I was thinking about that when I was watching that back in the day. How's the world going to handle that? Because the virus is something that I see as it affects everybody, even the animals now. So we're all in this world. We're all in this as this thing takes over. I hope it doesn't take over. But the question is, we're told to take precautions. Wash our hands, be conscientious, stay away from folks that are sick. But you know that the seasons turn into spring, and a lot of folks will be sneezing, and it's allergies. How do we know, and how do we decipher? I mean, and then when they go to the IHS hospital or 638 facilities, and they're displaying signs and symptoms, are you going to test them and send them into a lab, and or are you just going to kind of blow them off and say, it's just allergies? Go to the over-the-counter, get your medication, go home. Is that what might happen? Because it's like that, what was that? Opioids or something like that? They just handed them over the counter and said, here, this is for your pain, go home. Then it became a problem. Folks started getting hooked on that. I hope that's not the case here. I hope that the Indian Health Services, the medical staff, will be able to really help our folks in behalf of deciphering whether they have it or not. And the virus, when it comes summertime, does that virus wane off? Or will it still be active? We don't know. It's a new strain, I understand. It's called now COVID-19. If I wasn't sitting here and I heard that, I'd be like, what are you guys talking about? Now it's a new segment of classification or name. A lot of folks go by corona disease or coronavirus disease. So when they're educating folks out there, they need to ensure that the name is also known as AKA COVID-19. That's very important to know. And I understand too from earlier talk about this virus. The virus is also related to SARS. Is that how I understand that? And SARS started out in China too? Is that how I understand it? It seems like everything that is happening comes out from an area that is known for folks that eat different types of animals. And I've seen TV shows where, I don't know what the shows were called, but they would go across the world and they would be eating all kinds of different insects, bugs, reptiles, and it's like, who does that? Ada zibits ado that the no job bun does it. Ochin na hadan. Ako ishibini na the nejago yi yada ne. E yada with that egit uchi yada. Bini na do bahazunda. Eji watana tine. Dated when I was in the U.S. Navy, went to all over the world, and they would be eating monkeys. They would be eating snails. They would be eating snakes. They'd be eating even that pufferfish that has that poison. And they would be saying that's a delicacy. And we would be told, be careful what you eat out there. And I wouldn't partake of their diet over there. And that's one thing that we should really be aware of too. And yes, washing hands and making sure you're taking care of yourself. And I know my Honorable Delegate Stewart mentioned, we go places. Some of us are tasked to go to DC. We just load it up in the suitcase and we bring it home. Could that virus be on our clothes? Could that virus be brought into the house? Should we wash it before we come home? And without prevention, and even our shoes, even walking outside, you know, how do we prevent this? Back to the virus. Is the summertime going to actually wane this off? And then it'll come back during the winter time? Does it thrive and does it like the cold? That's the question I have. And then I heard too that Soli, our lungs, pneumonia, that's part of your immune system. If you catch pneumonia by this virus, a virus you can't prescribe penicillin or antibiotics. But once the patient gets pneumonia, are they given antibiotics? Or are they just told, you've got the virus and you've got pneumonia and it's just you just have to wait it out? That's my question on that. And then the Navajo Nation, we talk about sovereignty here. If this becomes a global pandemic, does the team here, the Department of Health and the team that you guys activated here for the novel coronavirus, do you have the authority to say we're going to restrict folks coming in from outside? I remember being with the Navajo Nation Rangers. There was a big talk about vesicular stomatitis. That was just an animal disease. Horses. Rangers were told with the health and the same team that's here. I remember seeing our folks. They were telling us to, any horses that come from New Mexico, they got to have health certificates, and they got to be, if they come from there, they're going to be quarantined. We took that measure. I remember sitting up at Norbona Pass. I remember sitting over here by the milepost 2, by now where NDOT is, and checking the livestock. And folks started really obeying those laws, but it takes a lot to do that. Do we have the resources to do that? Everybody now, that's why some of our delegates were concerned about that veto. Our chapters need to be funded so that they could get these things to prevent the spread. Even just material to pass out to say, this is what we need to be aware of. And the grazing officials, our livestock owners, how far is this going to go? And how much education are we going to do? So these are my concerns, and I hope that we can provide these answers and be able to keep from getting infected over here with the coronavirus, the COVID-19. Thank you, Shania.
Sheila, thank you. Che, gentleman from many farms.
The IS Bia Aiden, report that you like. I guess more of a coordination. I like to see, not necessarily that we tell you or dictate to you how to run this particular situation, but the key thing for me would be is a direct, specific information disseminated to the Navajo chapter, local chapter. We have 3 chapter officials, and we have the coordinators there, and then we have other chapter officials like grazing representatives and farm board, and then we have other staff there, CHR, and you got senior centers, you got Head Start, and so on. So I guess the coordination, some of our colleagues have mentioned, what is the overall comprehensive rather than having reports after reports. Pretty soon we'll have 6 or 7 IHS presenting to the council with different format or different information. I think that's more a better approach than having reports after reports as chair. So the reason why I was asking for all these handouts was I have 2 planning meetings today. Even I request to be excused. The IHS, the Department of Health, and even the local health board. Maybe do a series, not to the council, but to the public, to the people out there. I think that's more important, spending more time. A lot of us, if we're asked to be what it is and being educated, that tells us that we're not doing our job as being in leadership. This should be rather than help coordinate to say that 5 chapters, they need to be informed in this fashion and so on. So even if you guys don't mind, I got 10 copies were made, so I'm planning on distributing this to the local chapter, and I've already sent the information to the local chapter to ask and telling them. I've CC'd the division director from Department of Health, Division of Community Development, the agency, ASCs, the CHR, chapters, so if there's any effort about other coordinated from local IHS, what was the acronym for that one? On your chart, NACA, was it?
NACA, NACA.
Yeah, NACA.
Native Americans for Community Action.
Native Americans for Community Action?
Yes, sir. Flagstaff, Urban.
Okay. See, I mean, just to presenting this to the Navajo people to some extent, it was just much of looking at a maze, and I'm not sure what really, which part of the information that they receive is more accurate or not. So that's why I'm saying that I believe still Jim will be the prime, be in the prime position in working along with the other programs to disseminate these information rather than having so many people sending information to the chapters, and we're not really sure which is more accurate or more updated information that needs to be sent out to the general public, the public announcement, public information, and so on. So that's the ADAC Halet Allah Asaki ya like right now. Did Abeki he could the has did Alcon a the Hasigi quite cutting each of Hatney. rather than we're having so many people, unless we want to get educated, which is okay, but for me, my main concern is providing accurate information to the Navajo people, to the public. Ila isiki so nandini kishan tatoni hit akati was tato shite koto shikaho sando akwage my immediate family akwage which ahna shkhato lis win sinigi shitaka jo net ad ili papa jo pagya hui na to ado hit ash kishin dal nistik at tunleden the specific organization hatnini ki did ad ende dayat khato koto hitchet the organization structure hatnini ki koko I mean to resources hatnini the ende CHR I mean the koto chapter khato chiligi ta to bonet zango ko I mean what specific maybe equipments or whatever be add a husband or the hiki to edigi kwage other people be bahot ito be baholo no johot be bohnetza and who the local chapter that they have direct communication with the Navajo Nation government. So even I mean, not to be educated about what it is, I can read on it and educate myself on that, but more of a coordinated effort in the safety of our Navajo people should be the key thing for us right now. So, I request to be excused, Chair.
Okay. Thank you, Che. I guess what I'm hearing from the two panels that have presented so far is there is a coordinated effort. And the main purpose was to, I guess, demonstrate the structures that they're within their own aspects here, which is IHS and then with Navajo Nation. For us on the Navajo Nation, we can't really say step by step give guidance to IHS. We can do recommendations, but over here with the organization within the Navajo Nation, I think is where we really have more of a say-so. As far as supplies, just yesterday I met with my older brother and he was saying he went to Walmart in Farmington, went to Target. There's no masks on the shelf. But then those over-the-counter masks I'm hearing is it won't deter any transmission of that virus. So again, you know, what people see on Facebook or on television, it is a little bit different than from what we're hearing today. And so I think that's the part that we're trying to clarify. Again, lead Katna's a little bit because of odd. Not only to today's inkling. You see, other than nothing, spells and champadatni, even though you don't have the subject matter expertise, but they look at you to be knowledgeable. And that's, for me, the purpose of the work session was to basically make sure we've got a coordinated effort. And so, I see it, so, and then I guess the other part I'm seeing is the lack of information, how our schools, the public school, BIE, the contract schools, how they would respond. And I'm sure they'll be taking their P's and Q's from the IHS and the other healthcare facilities and the department. So that aspect, I think, as we move forward, like I said, this isn't just a one-time thing. This is an ongoing, developing response. And so that's basic to this presentation. I'm hoping there were several questions posed, some to IHS and some to Department of Health. So, hey, just a minute, I haven't excused you. Che, I'm just kidding. Oh, you're excused. Let's go back to Ms. So and your panel. There's some specific questions that were posed by Honorable Begay and Begay. We could go back to you.
Thank you again. Good morning, everyone. My name is Rosalind. So just to follow up, I think that Mr. Begay makes a very important point, and which we were talking about last week in terms of integrating our traditional practitioners into the education of this virus at all of our facilities. We have professionals that are at all of our facilities to be able to help us communicate and be able to help us address from, again, the traditional side to help with this effort. The second part that I would say with regards to communication and our efforts, we are working very closely with Dr. Jim and her team to identify appropriate resources. By that, again, we're also going to deploy our health educators to help create and craft some of these posters that could be made, perhaps, and not only just the simplified message, but also make sure that they are translated and communicated in Navajo as well. So we plan to be working with that as well. And certainly we're going to work very closely with Dr. Jim and her team about any requests at the chapter and community level. We're able to do that. However, as I shared from the beginning, we're going to be in this process for a long while. And having said that, we would ask for having doctors and nurses be out at these chapter meetings to be able to talk about that, talk about this particular issue. So we're going to have to work through and coordinate how we can make sure that we have enough resources at our healthcare facilities on any given day. Remember that we run five major hospitals within the Navajo area, so we need to make sure that they continue to be staffed up so far. But we certainly appreciate and understand the concern with regards to communication, with regards to providing educational material, whether they be written, verbal, or in-person presentations that could be made. We're also making sure that our frontline health facility leaders, our hospital directors and our health center directors are available to be present at local chapters. We've already deployed them to be able to do that. It will be very much the same information that Dr. Christensen provided earlier, again, to make sure that it's consistent and that we're educating our people as best as we can.
Dr. Jim?
And thank you for the questions too. So, this presentation that we have today, on the how do you say it? We worked on this together. Now I got confused here. So, these presentations we worked on these together to make sure we met together yesterday. We are being consistent. So part of that preparedness team, it will include education, social services, DCD, natural resource arts, division, tribal health organizations. They will be at the table. We were having a meeting with them on Thursday. So that's what we were saying around the Navajo Department of Health website. Again, we're going to make those available. So, and those calls that we have, these briefings, people need to attend so they know what the current status is, but we also need to push out information back to those agencies or organizations too. So those are the communication mechanisms that we have to ensure that all the communication is correct, because what happened over the weekend, CDC's website was already outdated within a day or two. So it's very rapidly evolving, and even today now you have the new state of Florida being impacted with cases there now from 7 to 10. So we should make those definitely available as far as working with everyone. And we did include and had discussions about involving traditional healers in our preparedness team as well. So those are the questions, I think, responses I have for Elmer Brigade. Thank you.
Okay, thank you. For everybody in the room, Eastern Navajo Agency Council is meeting March 7th at Tojile chapter. So that would be another outreach effort there. Dr. Christensen, Brother Raymond Smith asked a question. Could you, in your area, define epidemic and pandemic, if you would, please?
Yes, an epidemic is when there is a multiple amount of cases in a defined area. So Washington is having their epidemic. Obviously China is way more of it. So it becomes a pan-epidemic when pan meaning many or wide. So as it spread, it became a pandemic. When it becomes global, that means there's pretty much no place other than maybe Antarctica that doesn't have vulnerability for transmission of the disease. So we're definitely at pandemic and very close to world because it has affected every continent except Antarctica at this point. So epidemic is within a region, a state, a specific area, and pandemic means it goes everywhere.
Okay. The other, Brother Wilson Stewart had a concern that when a person sneezes, let's say it gets on the clothing, what is, I don't know if it's the proper term, the survival rate of the virus? Also, the other part, you were saying sneeze into the elbow, and I was thinking maybe it's sneeze into the fold of the arm?
Yes, correct,
Okay.
sir. Yes, I understand his concern, and to kind of answer this scenario, he said if we show up at a health facility, are we going to be told we have allergies? And I would certainly hope not. Everybody is on very high alert to be overly suspicious that these may be signs of a COVID virus, so it's going to be taken extremely seriously. And a full screening. We already have screening in our electronic health record that asks about travel exposure, wherever if any relatives or neighbors are ill. So we do screen all that immediately. Being that COVID is somewhat like the flu, both are serious and both would require placing a mask and taking care of the patient. So they're very sensitive to those questions right now. So action would be taken after that to determine exactly what that patient needs. We will be able to test a lot more than we have been, which is very good news for all the healthcare facilities, because the kits will now be available on a local level rather than sending everything to CDC, because they were deciding who we should test. Now we will have that option of testing people before returning them back into the public, if you will. So we will be testing all those appropriate for testing. So that will be much better moving forward. There was also a question about viruses and why they've been around so long. Well, viruses are very They're very survival-based. They will mutate. When somebody finds medicine for them, they'll mutate into another form. That's what makes it extremely challenging to treat the flu every year, because there's 2,000 variants of the flu, and we hope we hit the ones that are most likely with our flu vaccinations. COVID is not quite that broad. There's just a few species of COVID. So we're hoping when there is a treatment for that, it will be very effective. We do have treatment for the flu, and we do use it, and there will probably be many times that we're not sure of the COVID versus flu. We may use the flu medication initially, and then when the tests come back, we would adjust our treatment accordingly.
As far as, let's say, the virus landing on clothing,
Typically, it remains on hard surfaces better. It would not stay alive on clothing for very long at all. It is because it gets absorbed into the material. Whereas this or a lamp, your countertops, it can sit on there for quite some time, days even though it's dry. As I pointed out before, when the droplets are still wet, you could still inhale them if you're close to them. And once they dry, if you touch it and then touch your face or your respiratory area, you could still pick up the virus that way. That's why we really encourage wiping down surfaces frequently in your home or your office or wherever you are.
okay. Brother, so. Good morning, afternoon. Yes, good morning and afternoon again. I guess with the issue with the virus, that's the pandemic in Asia and sort of as it's here in the United States, and still it is coming, and I guess as Honorable Kiala Begay indicated earlier, that I guess the health facilities, whether it's IHS and the 638 programs, to probably unify and have one message, and with the Navajo Nation's Department of Health, I think that is something that is needed. Just with what we got a report from Navajo Health, got a report from IHS, and now we have our healthcare corporation here. And I believe it should be more of a collaborative effort to get the message out. And as this started, I assume that Navajo was already hitting the road and putting something together with IHS immediately, and to have three different types of information here, and I wish it would have been just one. And the reason why I say this is I had my chapter meeting yesterday, and that was one of some of the community members' concerns. And all I indicated is I'm not a healthcare worker. The healthcare workers, it's really, to me, it didn't look good to have, we didn't even have IHS there. We didn't have the Tuba City Healthcare Corporation there.
This was at a regular scheduled chapter meeting. And yes, the Tuba City representative wasn't there. Don't know where he's at. And getting to sound like Leonard Sosi here. And my buddy. But nasni desni o. Hashtash on late na jis ta on zin dana. Alate la on late. Ade isneho. بالله كنت النبش لحش اللي كان. Not even Department of Health. بديني. أكو ليت أكو كدونة نجيت. I guess you have a lot of public information to be, or public information to be relayed to the Navajo people out there. And I know that the healthcare providers or the healthcare workers, you guys handle and work with these scenarios. And maybe, the hospital is just up the road from the chapter house. Maybe Rosin So's shop can send someone over, maybe send one of their commission corps down there to give the chapter an update. Or maybe see if the commission corps there that is stationed within Tuba City Healthcare Corporation to have some sort of public awareness there in Tuba City. Because Tuba City is unique. We have community members as far as Gap, Copper Mine, Tonalea, Coal Mine, and Cameron, living and working in those communities. And I think if you guys could get some sort of information out to the public would be great. I wish I had what I have here yesterday. That way I would have had some to get information out to the chapters. The other is maybe if you could email these information out to the chapters so that they can have these pamphlets out there for their Navajo people that want to read up on this and see how the IHS and the Navajo Nation is actually taking care of this, how they plan to be prepared when that first when the virus crosses into the state of Arizona and into the Navajo Nation. I guess it is that. I can't dictate to you guys how to take care of the virus and things like that, but this public information is very, very important out there. They were asking me yesterday, this community members, they're in my town, how is the nation tackling this? How is IHS tackling this? And I just went off of Dr. Jill Jim's press release that came out that Department of Health and IHS are already working together and trying to strategizing and getting a readiness plan for this virus that's coming. More awareness out there in the rural area needs to be conveyed to the Navajo people. And then I always go back to we used to have, so when we had sheep, livestock, my grandfather's policy was your sheep and your horse and your cow is always supposed to be situated over the hill, not near your home, not near the living area, because the babanashni, the way gosh is nibanashni, the neda hadit ada but this now, which this ya tito lisni. That was their principles and their values. And One, the other was almost the one that was just think if there was a pandemic on or epidemic virus coming from dogs, what would happen? But I guess just the readiness out there to the Navajo people is the public education is probably the health care providers on Navajo needs to get out to the rural areas. And that includes the Navajo Nation, whether it's CHR or the other health entities that provide service on the Navajo Nation. Go ideya, this is a thought, and actually I did that with some kage, you know, that I had ishi, nashni to I let up each other. People always say, you know, live life to the fullest if you can. I should actually that way is tea. Need actually I like be tea. But we have a virus come in, and yes, the public education needs to really get out to the chapters, the healthcare providers providers that provide healthcare to the Navajo people.
Sheila, that's it. Mother Stewart and Trizette, I'm going to let Mr. Curley address the committee, and then we'll go back to you for statement and questions.
Yeah, thank you to Ms. So, and your IHS staff, also Mr. Shorty, for your presentation. Council Delegate, the baby toward the national national Ani, Fascist chain, Shane National, Ashire, Dashiche, the board president, Tibusi Regional, board president for 638 Association, the Kodabahan, Tingi, I see, I get a go, yeah, or skin of hot, Anna need out, the Tibusi day, out, the net bonar. Addressing some of these concerns, and in addition, I don't put a patient at the I don't very question I don't buy it public hearing that's it doesn't never job is not done, no job to Tashi, Korea, Hilda, but I just in the weeks on here 638 Association, including to the city regional. We might need to be specific to certain areas that we need to address this as a team, as a unit, unified front. As you heard, in the US, that's not so see those leaking. He looked at all the other kids. It's not so you want this case. Of course, she went out those leaking to the city. The AICD could all high end. We talked with our CEO, and I brought Ashdej with I see the technical side of how to address the this infection control. Chairman So, I'd like to request to give some time to Ms. Bazahalani to address on how Tuba City is doing their work on this COVID-19.
Yes, go ahead.
Yeah, she afraid of Bazahalani and she knock. I'm the infection preventionist at Tuba City Regional Healthcare Corporation. Beat between Nishta, Tachidi Bashichin, Sidnajini Dasha Nala, Nakai Dasha Che. So I know that a lot of questions are coming across for healthcare facilities. One of the things that we're actually really focusing on, and I know that's been brought down from our Navajo Nation departments, from our Department of Health, from the IHS facilities, and from the CDC website, is the idea of if we ever get a patient with COVID-19, and now at this point we're at when we get the patient with this COVID-19, how are we going to take care and manage these types of patients at our facility? Recently, we've actually really established an incident command, surfacing that. It's been a while since we've actually done an incident command drill. So the things that we're doing is clear coordination with our incident command members, identifying our chief sections, but also looking at backup for our chief section officers, because sometimes not everybody is in the facility at one time. And also make sure we're establishing bi-weekly preparedness meetings to be led by our epidemiology team. Epidemiology team consists of two co-medical doctors, Dr. Jane Oski and Dr. Jared McIntyre. They're our lead for our facility for epidemiology response team. And all of our information that's passed through to our community members, for our education, for our providers, for our nursing staff, EVS, for the whole staff of our facility, is directly coming from our epidemiology response team. And all of our information that we're presenting is specifically from the CDC as to what's expected, what we need to be clear about how we're going to be educating and providing patient care, optimizing the type of material that we're using in our facilities. Of course, training our staff, because we all know that healthcare members are at higher risk of having contact with individuals with COVID-19. So we want to make sure we're establishing protocols for isolation and triage of patients for regular or immediate care for all departments. With that being said, we're going around making sure that all of our healthcare providers are N95 tested, because the N95 mask is what's suggested if you're working with a patient with the COVID-19, but also proper PPE, the sequence of proper PPE. Our clinical education is currently working with all our providers and nursing staff, and EVS will be working with these folks, ensuring that our amount of proper PPE is readily available, and we're actually monitoring the PPE that we have. Unlike the IHS, we don't have one area that we go. We house our own procurement and materials at our facility. And recently we got a letter from our vendors, 3M, indicating that they are going to be halting on any type of exports from the China area. And unfortunately, a lot of our PP equipment is made from that area. So isolation gowns, N95 masks, wound types of materials are actually going to be on back order. So with that being said, we're actually really monitoring on a weekly basis what's being distributed to the departments, what's on hand, and what's in our storage area. Ensuring screening of all patients across points to look at the facility of what our entry points is if we ever have a patient that comes over. Currently, all of our patients who get appointments make calls to our call center. At our call center is where they're actually asking the screening questions of if they've with the respiratory season in effect, a lot of them are saying, I'm coming for a cough, fever, which are the basic items for respiratory thing. But I think one of the main things that we really focus on is international travel within the last 30 days. And then from there, we decipher how we're going to be handling these patients. If they ever have a patient like this, then notifying our infection prevention team so that we can help coordinate how a patient's going to be surfacing through our facility. We've also identified if we should house patients with COVID-19, we're looking at where we're going to be placing these patients in our units. So, other than that, and I know I've been in contact with Husan a lot of the time with our IP Navajo area. I'm pretty sure Dr. Herbert here, we spoke quite a bit of times on these items. So again, just making sure that the communication is readily available for all of us.
You're done? That was quick. Compared to Ms. So and Ms. Dr. Jim, Cecilia, Honorable Wilson Stewart, Jr.
Again, the staff and the directors and Aron da koro Jennifer Hilsnahos Nato Jennifer Sa Linigi not so Kasha Jow, then Hilshano Sa the Only thing I would like to request in Nandish Kirigido, for your staff in the hospitals or even at the staff you work with, considering that these patients come in on a daily basis. And we know it to be like that, to where they come in, they go in through triage, they get seen, they get their medication, they get released home. With this that's going around, this virus that's going around, listening to the discussions, please let's have a follow-up with these patients. Just don't let them go home. And every month, at the chapters, there's always a report section, whether it be for IHS, whether it be for 638 hospitals, whether it be for CHRs. There's hardly anybody that goes there to represent these entities. I stress again that you make sure that those staff go there. And make sure that it's qualified staff that can talk both English and Navajo. But for the information on the, we will take that back. Chapters, planning meetings, planning meetings, no chapter meetings, 110 chapters. And here, on a daily basis, this news, this update changes. At these 110 chapters, if you're making the effort to go to the chapter meetings and planning meetings. But we want to be informed, we want to be kept updated. Emails, phone via. Underneath Seneca. But all could out on this case though, for your efforts, your work, though the on the out and his the husband that the dequaggy virus on the egg in the I thank you for doing what you're doing to at least educate and make our communities aware of it. There's over 75 or 77,000 community members that her and her staff went out to go see Ms. Herrera. Because that's what is needed. But to continue to do that effort, thank you.
Okay, we go to Suzette, Honorable Elder Gay.
Dr. Jim Dodo, we as a Navajo Nation Council and on the Navajo Nation, we depend on her system because there's already government, there's already structure where anything that's relating to health issues, we rely on this government because of that is part of the government, the Department of Health. And all the staff that are in it, some of them are out there, out in the field. I call it out in Dakar. Sometimes I always say something to some staff of hers saying that, you guys should be out there, don't let, it shouldn't be like where people visit your office, the people coming to your office. You guys should be out there, go out there, because of that is that's where the issue is. The issue is not in here at Window Rock, it's out there. People that are in need here, they're out there. You have vehicles, you have all those people that are out there. Make sure they go out there. Make sure these monies that has been appropriated for these fundings for the health of the people, make sure it reach those people down where it's needed. At the Abansas case in Little. So through that, is how, if there's any issues or any questions relating to health, I always depend on the Department of Health. So I thank you for that, with your staff. So the question came from Navajo Health Education regarding the question that I had on this issue of traditional practitioners. How is the Navajo people, or how can we protect? Is there a way that, is there anybody out there that's thinking about how the Navajo Nation, how the people can be protected from this virus? How do we know how to implement that? I guess that was the question. So through that, that I was, there's already some people that I told them about it. There's a group of people that were out there, which some people, they don't post it up in Facebook or on chapter house flyers saying, hey, there's a meeting. There's a traditional ceremony going on. Individual families, they have it at their own place. Being in contact like that. Even these people, they get together and they bring money and they host these kind of meetings, these kind of ceremonies. Through that, the Department of Health, we have a behavioral health the practitioners. I wonder what their plans are. I wanted to see that. What's their plan? What's the provision? Department, the behavioral health. Any traditional practitioner. What's their plan? What are they going to do? And how are they going to reach these people? How are they going to assist others? Now, as far as 638 hospitals, they have practitioners there too. How's their plan? To help the Navajo people to or utilize our own belief. Contacting these, as you guys have IHS, and then goes down to the 638 out of the Equity Division of Department of Health. You guys are all, coordinating this, but practitioners are they coordinating out there like they with the people? How's it line up? How's it? Or how's it never still like that? Or if it's like this, they do this what we call nahoti hasling, nahoti do this kodeo. Then all we're saying is how do we prepare? I don't think yes, Khalid able to the Zendoga Belkit or Dahila, Khalid about here or Timila, Khalid Kate Nazla. That's all the other. Jot that even I just killed Khalid and Jade about it at the Kujib, the Ghana Kashigi, is there to think about it as they are case. Kuzuko eat and Hitchco again. Panzas case, idiot are the Baptist to as Sweden Lenikin died, what Ella, the Shindy, a Bada, other East Ado, and how to the other Yin died, the Kitlo, Yin dash the Kitlo, how hot up on the door, Halida, a Banza case. quite a lot now, quite a bar, in lady, Halit Ella, down no, but again, that is Kitty, and they are a hashing so with a so does in the Yilashi, just up upon the skis, not what else, quite a touch of out a year up and his one that don't need a shoulder, so the need a Yilashi. Go area, area been Nasia or the been like the skitoli. So
Sheila, to board chair, Mr. Curly Chanel, regarding practitioners with 638. Ishing Sadoli, and then we'll go to Dr. Jim and then to Ms. So. Agashin here, can I take Kirigi, Arasatna Ash Elmer. You know that I want to run this by our 638 organizations with Sally and Alcoa Fort Defiance. And we're getting a meeting together, a teleconference. So this should be this as part of the agenda item. See if we can get our traditional medicine in our hospitals to come together. Even to I'm already wrote it over here. Halit Allah coordinate all the traditional health to address this COVID-19 and any other issues that are out there. Didi Oyon Tzchal, and then it's like, kind of anticipating it, like you said. But we'll see what we can do. And we'll include you in the coordination of this. They can act as an advisor to be able to see how we can bring this together. But at our next meeting, it's either going to be this Thursday or next Monday. And we're going to do, we'll do a teleconference. See if we can identify a date. We can get this addressed. And it'll be good to have you there, and other delegates are welcome to attend that, to be able to see how we can get this done for our people, so our people can have at least some peace of mind that they're addressing not only the physical but traditional, emotional aspect of the healing part of it. It's not that.
Oh yeah, that's Elmer. Actually, do it's not on the Shananishi 638, but we'll probably join them. Although I access the traditional practitioners just up on in the store. We can certainly reach out to Vice President Rex Lee Jim. He's the tribal liaison. Perma Health we don't have a traditional practitioner. Hopefully we have someone in that position in the future that can oversee all the Department of Health section. We are working on a grant that we received that will be working on the opioid stuff for that, but we need a in the future that can address things. But in the meantime, we're already kind of coordinating things. So when Chris is talking about his section, most likely everything is going to be centralized and focal point for the Department of Health. And so I can assign one of my staff to begin looking at those sections, and we'll certainly include you. We'll include you on that conversation as well. There's a lot of questions that they were saying that the cell up it looks like a crown, but all the other similar viruses have a crown figure too. So we'll be having those discussions about the distinction about what would be the name for them. Joe, in the video earlier, it talked about the different years and how it's not coming from SARS, but it's similar like Bishop, we'll have that available, but we'll coordinate with IHS and 638 and making sure everyone had echoed to make sure that we are consistent with our information. I think down to even the materials, and it's a matter of coordination. We got this group together, so we have to be really aggressive about it, but also be cognizant that the Navajo Nation EOC would need to be ready to be stood up at any time. And so we need to make sure that under Division of Public Safety, Mr. Cleveland has to be ready, and we'll be he will be included in a lot of these efforts if that does happen. So, I do.
Thank you. Ms. So.
Thank you. Good afternoon again. As I shared earlier, we are already integrating into our planning efforts the role of our traditional practitioners, and we will continue to do that. Again, I think what I'm hearing today is this need for consistency, simplifying information, and making sure that we have information shared in the Navajo language as well as the English language. So we will continue to do that and work side by side with Department of Health on the Navajo Nation Department of Health and our 608 partners to make sure that we do that. In addition to that, we know that many of our patients do migrate out into the Phoenix area Indian Health Service as well as the Albuquerque area Indian Health Service. So anything that is cleared and provided, I'm working with my two colleagues in those particular areas to share information as well, because we know that many of our patients reside in those areas. So we will, and I think that, again, this conversation today is just really magnifying the need for a centralized communication effort, which I think that we have established, and we're standing up with the 2 and 3 entities working together, as well as those private sector that are close by that also treat our patients. So we'll need to bring them into the conversation at some point. Thank you.
Anybody else? Before I give the floor to Brother Walker, one of the presenters want to do perhaps something that you feel like we've left out of the presentation and answers to the colleagues' questions. Oh, Herman Chorley.
Yes, excuse me. Good afternoon, and thank you very much for the recognition. I wanted to speak or answer, speak to a question that was brought up or concerned with my Honorable Council Delegate Otto So, as far as the presentations and some of the comments that were made by some of the other council delegates as well, as far as the number of presentations. I think my understanding for this workshop was to provide a broad understanding and to bring to your attention too that we are all responding from the health field under ESF number 8, under the All Hazards Plan, and as an annex. In that respect there, ESF, Emergency Services Function number 8, encapsulates public health and medical services. So we complement, there's a complement of each from the tribal NDOH is the public health proportions of it and the preparations and information dissemination to the public as well as other entities. And Indian Health Service and 638 tribal organizations, that's the medical aspects of the medical services portions of it. And even like for the facilities, they have also the public health component in their areas too for their respective service areas. So it's a complement in that service, so that's that coordination. And to address the areas that we're working together, we have been working together for NDOH, I believe that I can speak with that we started working together since February 3rd, I believe, after it was first come to light that week, previous weekend there. And then for, I think, Indian Health Service and some of the other facilities started working for their respective areas. I can't speak true to them, but basically I trust it. And in our communications at that time, we're also in the processes of applying and providing or gathering information so that we had a unified understanding and provision to provide the information as we have now. Thank you.
Thank you. Brother Walker.
Thank you, Chair Pro Tem. Again, committee members and then presenters, all of the presenters. Tuba City Regional Healthcare presenters, I guess as delegates, hey, we first think about, the region, the areas that we represent. When you listen to issues of great concern, like public health, emergencies, or some environmental health issue, naturally we're more inclined to think about where we're from, people that we represent in that. So with that thought, the areas of Cameron, although thinking in the Western Agency area, Monument Valley, these are where our, people from the outside off the reservation come in to visit, because these are areas of interest, points of interest. These are areas that are popular to travelers and tourists, locally, regionally, nationally, and internationally. So I would think that those are areas that could be sort of like the gateway, for all kinds of things, actually. So with this public health concern, they would be also gateway to those kinds of problems, because there's a regular steady flow of traffic coming in by the bus loads, although individual, families or individuals traveling through just for a few hours or a day or two. So just thinking about that, and wanted to just put that out there, that's a concern. I don't know, beyond educating the local community members, then some of the people that interact with these travelers and tourists, and one of the most effective ways to talk about sensitive matters like this is person to person, actually. Sometimes the media is good, and then social media is probably the most effective, but that can go either way also. People can take that serious, and people can laugh it off, people can misconstrue it, distort it, That's just our human behavior and human nature to do things like that. Delegates, Autoso and Nanana, Delegate Brigade, the neck catcher, you put a Navajo perspective. Our cultural protocols also mean that if there's matters of great importance, that issue must be communicated firsthand, in person, the local dialect, using cultural protocols. Niniki, I tend to agree with that. I think if you were to go visit or organize a visit, organize a meeting with some of the people that I mentioned, mainly the vendors that sell alongside the roads to the tourists, to the travelers up these routes, Highway 8 and 9, the Highway 64 that goes to Grand Canyon. Make it a point to meet with them and tell them about the concern. Most likely some are not paying attention to the media. Maybe they are. If they are, that's good. But they're business people, so they're busy making money, and they don't mind people coming in to their midst, to their booths, to their circles, and interacting with them, because money's involved. That's their livelihood. I guess I would want Tuba City to make it a point to send messages even to those groups out there, especially the vendor groups. You have health educators on board. You have public health nurses that can usually do the field work. So please include our people, because I think they're mostly, I don't want to think like that, but they're mostly exposed, Johnson. A traveling vehicle or a bus stops at their site, and then all of a sudden you have a dozen foreigners right there visiting and interacting. I just can't help but think there's a concern. So if they're proactive, if they're cautious, that would help. And then that they safe social distance, that people would be mindful that's the way to be these days. And then not, so Tuba City healthcare provider, I guess I would leave this concern to you. You have the means, you have the abilities to do what you need to do to address the public health issues and concerns of the day. Of course, there's Four Corners, there's Canyon de Chelly, there's Chaco Canyon. We have a beautiful, beautiful homeland here. With that, we attract lots of people from all over the world. And I don't think we're being paranoid. We're being cautious, we're being proactive, we're being concerned, and we're being protective. So, Nana.
Priscilla, Cecilia, I think that's a good summary of this aspect of to summarize it. We're being protective, proactive. John, committee members, anybody else want to make a closing statement or any other aspect? But several of the delegates are going to be going to Washington, D.C. or even to Clark County. Don't think I'm being rude if I stay 6 feet away from you. As part of the recommendations, that's just kind of, not to really make light of it, but that's kind of the picture that we're receiving. I guess it's, in a lot of ways, some of these recommendations, it's going to affect us in immediate days, how we practice these precautionary items that have been presented. It is, for me, it's of great concern. If the pandemic does reach the Navajo Nation, you could almost see school cancellations. You could almost see events being postponed. So those are some great concerns that we have in our aspect of being cautious and guarding our own people. Mr. Herman Shorty, Che, did you have further?
Jay, Chairman Pro Tem, one closing remark I'd like to be able to reiterate again and also inform the recent concerns regarding Mr. Honorable Walker, in the sense that we were honored to present information such as this to the Parks and Recreation staff, personnel those that worked at the Little Colorado River Gorge, the Antelope Valley, Antelope Canyon areas, Slot Canyon portions, staff that would man and work the Monument Valley areas, and then even staff that work from Window Rock here as well. We provided them the information that we presented to them to ease their mind and give them a better understanding of those areas. Following that, though, we did also make the same presentation of the concerns that were related to the Slot Canyon owners or operators and their staff that were able to make it there. So I appreciate the concept of broadening that spectrum to maybe involve those roadside curio sellers in that respect there, and maybe community aspects. And so I think that could be as a doable item to address their peace of mind in that respect there following this.
Sheila, I guess the others for all the members that it, I guess, behooves everybody to, when they feel like there needs to be an update, don't be shy about requesting further updates, because it is a fast-moving item day to day. Dr. Christensen?
Yes, I just wanted to update the group that 4 more deaths in that same facility in Seattle just came across. So I think that just really intensifies everything we've said today, that we are here to keep everyone safe. I don't think we should feel bad or regret if we have to do things like cancel things, keep people out of certain areas. The most important thing is to keep everybody as healthy as possible, no matter what we have to do. So I encourage everybody to think conservatively and protectively of the people and of our facilities.
Thank you. Dr. Jim?
Yeah, as a reminder, regarding the update, we have those weekly briefings, so just dial in every Monday at 8:30 just to listen in. So I would just encourage everyone to do that, including the delegates or the chapters, to see what's going on. So those are the 30-minute briefings that's open that we will be doing. So if we need more in-depth follow-up, then I do support the recommendation for me to work with the 638s and IHS to do one comprehensive update in the future as we progress and to save on time. And I think, I don't know if this was on Facebook Live, is it, Byron? And so hopefully the delegates can relook at the whole, how many hours has it been? On a weekend or sometime to get up to date, so 4 hours. So that will be helpful. Maybe that can be an assignment to them so that we were not repeating a lot of the information. So, and then we left all the handouts for them too. So I think that will be helpful just to reiterate the recordings, the webpage, the email, the phone numbers that we have, and then everyone else's contacts. So I do think that we're going to have to be a little bit more aggressive and that's all, yeah. So, yeah.
Okay. Committee members, other presenters, everybody in the chambers. So, one more. Another, Mr. Cruz. Facebook hado nene kare hado nefte. This na ahya na kado aron zonago yam di kado pahuin ti do sin zonago hot edan de jo kado be pani sago kado banit. This is the beginning. I see a lot of collaboration in our future and looking at unity. And I think our CEO went back into the cities right now, working with CDC on the phone with them constantly. So I think there's many more meetings ahead of us between IHS and NDOH, and also inclusion of the Navajo Nation Council delegates
to make sure that we're all in the loop and we're addressing the chapters. I think chapters is one of the biggest communication tools that we need out there. Sometimes it becomes difficult to try to interpret English terminology, medical terminology, to try to convert that to Navajo. Oh yeah, anan kahaya inde a benil anigit ashe yakudo nikidene bikin kishinda hadil neto ada bahas tibet ni kudo jo khadin kisinda khan kis tabet no shi tabedeshne badin klab anil tskobayil tioshi anita nozil ashaidin ne yaltio lado uyeto to yo klanda dalle lo akosh ashni ashni tskot bande tino le ko hidi kode board of directors which is nasha to city do njuno ya hindi ne shot ako dikodo planning meeting ba nada ilde to shi ada nadi khido le ko o head gele de shi ko na ana tini kon hisol tsara kon hilna harun khid ne ba it ko ra snada head. Thank you very much also honorable council delegates for listening to us in our presentations, as we'll take this back to our communities and try to send this out to some of the needs that we know that we can address and prioritize these issues that we brought up to the table. So, thank you.
Sheila, back to Tsula. Mr. So from the west.
Good morning, afternoon. Yeah, morning. But not morning. Sort of took my time coming in. Left the place about 7:30 this morning. The other is you guys may have already talked about this, but the collaboration between the schools. How is Department of Health reaching out to the state and to BIE, to the grant schools, and so forth, even Head Start? How are you guys getting ready with the aspects? Because you have tribal, you have other programs such that people congregate. And I always say that when they're sick, they have their throat lozenge bag, and they have a little plastic bag. They cop the cost So, but what I'm getting to is, how are you guys working with these schools? These like the senior programs. Because almost every day, every day. Senior programs throughout Navajo, a lot of them, they have like respiratory illnesses that are already, that are suffering from respiratory illnesses existing, whether it's smoking or, secondhand smoke or whatever, if you're talking about an epidemic and pandemic scenario, when you look at movies as what Mr. Honorable Smith was talking about, you look at movies and that communication from the healthcare providers and yeah.
Thank you. Committee members, since we're getting close to March Madness, at high school in Arizona it's done, but over in New Mexico it's starting this weekend. So in that respect, I guess, so we huddled up, we called a play, and now we go out message as a team. As a team, and we go for the 3 points. We go for the layup, and we go to steal the ball from this outbreak. So that would be my thoughts as we go forward. And again, you know, the development of these flyers, I think is key. Something that's simple, that can be handed out, and simple enough that even, let's say, a grandson, a granddaughter could explain it to their che, their masana, their nala. That message, that type of message, I think is something that we really need to look at too. And again, as we go forward, we'll keep everybody in the loop. So, with that, committee members, if there's nobody else, then I would say we've concluded our work session. Are there any announcements? I don't know if BNF is meeting tomorrow, but it was on the schedule. I've got legislation going before them, so I know that BNF is meeting. At the same time, there's a presentation by the Bureau of Reclamation regarding water management plans at NDOT tomorrow starting at 10. Don't know if Resources and Development Committee, we've got that notice. I got that notice because we're trying to do the Rio San Jose, that's in eastern Navajo, Baca Pruitt, Casimiro Lake area. And then, of course, the 5th, we've got public hearing on uranium. The 6th, we've got public hearing. Maybe that would be another time to do outreach. This 5th is in Shiprock, Diné College at the South Campus. The 6th is NTU Crown Point. Every place we can do the outreach, the education, we'll pursue it. But Ayla, those are my thoughts in that regard. Then, since it's my first time presiding over Mr. Rico, how do we handle adjournment? Do I just close the meeting? Okay. Okay, we'll just close the meeting at this time. And you guys are excused to take care of business. And thank you, each and every delegate. Thank you for coming, and I hope we have some effect in getting the public notice out.
So do most people. I always tell people, I'm sorry if I don't get on the basketball court. Good to see you. Thank you.
Well, he usually leaves it after.